Room I'll be receiving.
A serious case is coming in.
We've got an 18-year-old male who's been tackled playing rugby. Immediately complaining of severe chest and neck pains. He's having some periods of apnea lasting up to a minute at times.
You'll do primary, you'll do procedures. So we've got anaesthetics.
Dr Jonathan prepares for the worst.
Neck pain, strange breathing pattern.
Spinal cord injury.
I guess that's what they're getting at, isn't it? We've just heard there's a patient coming into trauma too. He's been involved in a rugby tackle and he's collapsed and he's had an issue with his breathing. And all that to me makes me worry, has he got a spinal injury?
I believe they're on their way.
Paramedics arrive with 18-year-old Katu, who has breathing difficulties and severe back and chest pain after collapsing at a school rugby league tournament.
There we go.
Is this the rugby gentleman? Yeah. And he's breathing now?
Yeah, bit of an unusual presentation.
Why don't we come on in, get him across, give us a handover, we'll do the primary survey and we'll go from there. So suspected spinal injury, just be careful.
On 3, guys. 1, 2, 3.
This is Katu. He's been tackled to the ground. He has had severe chest pain, midline neck pain, and he's then had a couple of episodes of apnea at a couple of stages. His friends have done CPR on him.
Stopped breathing and they've done some CPR.
Yeah.
Whenever we hear that someone's not breathing or had periods of stopping breathing, that's an absolute emergency. Is he breathing normally? How are you feeling there, mate? Where does it hurt?
Equal.
Chest. Is it in the front of your chest or in the back of your chest? Front of your chest. I'll echo him and have a look.
Dr Jonathan must quickly decide if they need to take over Katu's breathing.
What time was the accident?
About an hour ago.
An hour ago, yeah. But he's breathing too quick. There's no pneumothorax on the left. Lungs look okay and his abdomen looks okay. I don't see any injury to his abdominal organs.
Katu may have struck his head when he collapsed on the field.
Do you want to do a neuro assessment, find the level?
Yeah.
He's moaning, right? Is he actually compos mentis or what's the neuro?
I've had conversation with him.
Yeah, okay.
Squeeze my fingers in this hand, squeeze your right hand, squeeze, squeeze, squeeze. Pull this left arm towards you as far as you can. His upper limbs have got more power than his lower limbs.
What are his pupils doing? Are they equal? Or?
So the pupils are reactive.
There was back pain and neck pain and chest pain. So chest x-ray will help me have a look at the ribs and again at the lungs.
X-ray when you're ready.
And he's collapsed on the ground. He's been in rugby, so we'll have a look at his pelvis as well. Yep, I do. Great. That's perfect, thank you. All right, so the x-ray is normal.
Katu's dad was at work when he got the call that no parent wants to receive.
When you get a phone call and you got to go home because your son's in the ambulance, your heart just sinks. He's normally pretty healthy, no dramas. This is nuts, it's just shock.
Katu stopped breathing and needed CPR on the field. An ECG will reveal any immediate heart problems.
That's beautiful, that's fine. So chest x-ray is normal, his pelvis x-ray is normal, his ultrasound's normal. So far, all normal. So what's going on? Does he have a spinal injury? Is there something else? It's not really clear yet.
Focus on your breathing, okay, and not to move your neck.
Dr Papson must solve two problems. Why did Katu lose consciousness? And why is he having difficulty breathing?
Very worried about this boy. I'm worried he's broken his neck sort of about here somewhere. That's what I think it is. There's a chance of paraplegia, there's a chance of quadriplegia, so all your legs and your arms not working properly also means that you don't breathe properly. And that's an awful way to be.
Emergency Registrar Dr Terry Kane from the UK has only been working at the Royal Melbourne Hospital for a few months.
I moved to Australia mostly on a whim. Came here for 1 year, 1 year's become 4 or 5, and I'm a permanent resident, and now you guys can't kick me out. When I first applied for medicine, I actually wanted to be a child psychiatrist, and the more medicine I did, I realized I liked to be a generalist. I kind of fell into emergency medicine. It was terrifying at first, but the more comfortable you get with it, the more interesting it becomes. I really enjoy it.
2 broken arms. Not a good day for him.
Okay.
Dr Terry prepares for his first case of the day.
We've got the trauma imminently coming in. We're just looking for mobile X-ray to come to trauma 2.
Paramedics have rushed in 24-year-old forklift driver Michael, who has multiple injuries after his motorbike slammed into a van.
If he's stable, let's transfer, then we'll do a proper handover.
Let's do that. 1, 2, 3. Everybody, so meet Michael. He was a motorcycle rider and he had a helmet on. He was seen to drive into the side of a minivan at quite high speed. We think between 60 and 80 kilometres per hour. Just complaining of severe pain in both of his wrists.
Okay.
Where he's got a bunch of missing teeth and blood coming from his mouth.
Okay.
He had a compound fracture to the left forearm and an angulated fracture of his right forearm.
What's going on?
He's had a pretty big accident. He could have some quite life-threatening injuries. The fact that he's confused is never a good thing. It means that he's potentially got a bleed on the brain, and we don't know the extent of that.
Ow! Sorry, mate.
So there's blood coming from his left forearm.
But they didn't report significant blood loss.
No, they did not. Why he's so tachycardic? He's tachycardic, so his heart rate is high. It's an indication that you could be bleeding from somewhere and your heart's trying to pump faster because your body's not getting the blood.
Uncovering what's making Michael's heart race could save his life.
He's on a ketamine infusion, which also drives up your heart rate. So it's probably going to be multifactorial. There is a question of blood loss, but I'm just waiting for more investigations first. How are we going on with the EFAS?
His lung slide present bilaterally.
And nothing in the tummy?
Yeah, abdomen looked okay.
Perfect, all right. His EFAS is negative, so it shows that his lungs are expanding appropriately. There's no blood around the heart, and there's also no blood in the abdomen. All right, we're about to do X-rays. Everyone not wearing lead. You want to head out? Great news from the ultrasound, but it might be a different story with the X-rays. Everyone in there is wearing lead, yeah?
X-ray.
Does it show up on here?
Pelvic fractures.
Pelvic fractures? Ooh. X-ray of his pelvis, which looked like he's got a couple broken bones there, which can be life-threatening because you can bleed out liters from your pelvis. That's his forearm? Left forearm? Yeah, there you go. That's his right? Just there then, yeah, cool, all right.
An open on the left and a
Closed on the right, yep. Broken bones in both of his forearms and wrists. Both sides he could lose function from his arteries and nerves. They are such horrible injuries.
Oh, me.
We could probably give him some fentanyl as well. He's got multiple pelvic fractures, yeah. So fentanyl will be great for him. This is the worst trauma I've had to deal with. I'm very concerned about Michael's condition. Hey, Michael.
What happened?
Do you remember coming off your motorbike?
Nope.
Is there anyone you want us to call? Your mum? We'll see if we can give her a call, let her know what's going on, all right?
Michael lives with his mum, Michelle, who's been contacted to come in straight away. Emergency nurse Chelsea Jones gets him ready for a CT scan that will reveal how badly Michael is injured.
And I'm going to need to take your piercings out.
He's got ketamine in him. He's not going to know what to do.
What happened?
You're in a motorbike accident, darling.
What the
Michael's forgetfulness could be post-traumatic amnesia, concussion, or he could have a bleed in his brain, which is very concerning.
All right, we'll just wait for CT. I'll come with as well. Right. All right, cheers. The great thing about getting to CT is that you get some answers to the questions. Yeah, let's roll. The problem with going to CT is that you're away from the safety of the emergency department. So you're going there with limited resources, and it's quite scary when somebody's unstable.
You've done a pretty good job of breaking both your arms, and we think a couple of bones in your pelvis, but we're just going to get a CT scan, okay?
He can't remember the actual accident itself, and he can't remember us telling him over and over again. He doesn't know where he is, he doesn't know what's happening. So I think he forgets like every 15 minutes.
How bad is it? Tell me.
Well, we're just getting the scanner right now, right? So we'll find out very soon.
Hello, Michael? Yeah. G'day, my name's Dan, one of the radiographers. All right, just keep nice and still.
We're scanning from his head down to his hips, and we're doing something as well called a CT angiogram. And that involves us giving an injection of contrast dye. That will highlight all the veins and arteries so we can see if there's any bleeding, any leaks inside of him.
Have we done the brain yet?
Dr. Terry's worst fears are confirmed.
Yeesh. Yeah. He does have a bleed in the brain. He's got rib fractures, both sides. He's got some spinal fractures. He's got a sternal fracture. He's got some pelvic fractures. He's got a acromion fracture, which is part of his scapula into his shoulder. It's mangled. And he's got the wrist fractures as well. That would hurt so much. He's broken nearly every bone from the shoulders to his pelvis. Transfer on 3, 2, 1, go. That's it, nice and slow. Beautiful. How's your pain doing?
Pain's tolerable.
Good, yeah, sure.
Suddenly, Michael's in serious trouble.
He's just got a blood pressure of 89. I'm recycling it.
Sure, okay, it's not a good thing. His blood pressure has now dropped. He's now become less stable than he was before. Now I'm terrified. All right, we should probably get him back as soon as we can then.
Yeah.
Let's go back now.
Yeah,
Should we
let's go back. If you take the airway bag, I'll get the mat.
That's fine, let's go. The worst case scenario is coming to light. We need to get him to trauma as soon as we can. We need to be able to stabilize him as fast as possible. Go, go, go. If his blood pressure drops any further, he can arrest and die.
"18-year-old rugby league player Katu is struggling to breathe after collapsing during a game of rugby.
I don't like all this high respiratory rate distress. It might be better to tube him, but then there's the risk of the neck, right?
Yeah.
The act of intubating, so putting the tube through, may actually move someone's neck unless we do it super cautiously. So I'm just weighing up what's the best course of action here. Is he safe to go to CT the way he is?
A CT scan will reveal if the game he loves has changed his life forever.
So I think he's got a high spinal injury.
Yeah.
We're going to go now,
Yeah.
and then we'll make a diagnosis, and then we'll all be happier.
Okay.
My name is Megan. I'm with the other trauma doctors. Have you got family, buddy? Yeah, you're home with mum and dad still? Yeah. If I keep your head nice, you'll be okay now.
Katu's dad and family are anxiously waiting to see him.
Pretty scary time for us as parents. We're still trying to get our heads around it, so yeah, it's just so random. You know, it's been really overwhelming, and he's just a great kid.
We're going to go to CT. We're not going to tube him. We're just going to go like this, and we're going to get some information.
The CT scan will be a nerve-wracking few minutes for Dr. Jonathan.
So I think he's got a broken neck, so just be very careful. We're all thinking spinal injury, and I guess it's one of those things we don't really want to say because it's just so horrible to think about. But that's what's on our mind. When are we going to see that fracture, and how bad's it going to be, and what will it mean for this poor guy?
And on 3. 1,
Nice and gentle.
2, 3.
It's still cycling.
That's not a good thing.
No.
24-year-old motorbike rider Michael is being rushed back from CT after his blood pressure crashed.
I'll take another BBG, make sure his HB hasn't dropped.
Oh my God, so much pain.
Do you feel dizzy at all?
This is my hand, it's in pain.
Your hands
Yeah,
are
I
in
know,
pain.
buddy.
Oh God.
With critical injuries and a brain bleed, he's going rapidly downhill.
What's it? Is he acidotic? Let me just have a
Yes.
look. Yeah, that's not good. His blood is more acidic than it was before, which is a sign that he doesn't have enough blood in him. So we have to give him more blood right now. Give him a unit packed red cell stat now.
Yeah.
My arms are suffering.
I know. We're getting some painkillers right now, okay? His pain is out of control, so we need to be able to give him some morphine, fentanyl, ketamine, which he's having an infusion for now, and we're still struggling to get on top of it.
Ah!
Can we pull that up? There we go.
Oh my God, physical pain. Oh.
Just give me something for the pain right now, okay? Starting with 50 of ketamine.
Gonna make you a little bit sleepy, buddy.
He has broken wrists and forearms. The concern is that he's causing damage to his nerves and his arteries. So what we need to do is sedate him, make him nice and relaxed so we can pull it back into place and keep it that way. Is everyone ready to go?
Yep.
With Michael sedated, his right wrist is straightened and plastered.
Good job, very quick.
The team can now work on cleaning and immobilising his other arm.
He has an open fracture on that side, which is much more concerning because you can get an infection within the bones themselves. So we wash it out as best we can and then put a plaster cast over it.
Ready, set, go.
Michael's fractured pelvis puts him at high risk.
Well done, well done.
You can bleed out from your pelvis if there are broken bones there. So a binder keeps everything nice and tight, so it minimises the amount of blood that can be lost.
I can't move. I can't move.
All right, buddy, what's going on?
I can't move.
You've had a motorbike accident. You need to stay as still as you can, okay?
Ow.
Could do with a bit of help, yeah. Just rushing to get somebody now. I'll be back in just a sec.
Yeah, of course.
This man is in extreme agony. I'm really struggling to control his pain, so I need more senior support to figure out how else I can solve this issue. There's so many teams involved, so it's just trying to figure out how to manage him.
For such a complex case, Dr. Terry calls on the experience of emergency doctor Martin Dutch.
He's in loads of pain, he's writhing around. I don't really know what I could do for him.
Let's go to bedside and put him out of his misery. All right, let's do it.
I think he's got a broken neck, so just be very careful.
Just 90 minutes ago, 18-year-old Katu was happily playing rugby league.
You're going to be fine. Hang in there.
Now, he's about to be scanned for a life-changing spinal injury.
We are very anxious that we might see something catastrophic. So I'm kind of preparing myself for a nasty spinal injury and then all the things that flow from there. It's just a heart sink moment when you see someone with a broken neck. So I'm hoping I'm not going to see that. These are the ribs. Normal. Okay, this is his back. Normal. That's his aorta. Sometimes it gets an injury to it, but that also looks normal. Good. So I don't see a broken neck. I don't see any injuries at all, really. We're clueless still. It actually looks all right. So from my quick side-on view of Katu's neck, I'm not seeing a fracture. Now, we'll have to go through in detail, but grossly things look like they're in the right spot. So that's a relief.
Katu is not yet in the clear. Dr. Jonathan needs to know why he lost consciousness and is still struggling to breathe.
Could it be that he just was winded, got the CPR, hurt all his ribs, hurt his back, just too sore to breathe? Could it be that? Pretty extraordinary. Sometimes things are easy, right? Sometimes they're not easy. Tuesday afternoons, it's not easy. This guy's challenging my clinical acumen. Why does it hurt? He's only young, right? So he could get one of those weird spinal cord injuries without a fracture. Yeah. If you're younger, you can actually bruise and hurt the spinal cord without having a fracture. And the CT won't show us that. So we're not out of the woods yet.
Keeping Katu's sore neck stable is the team's highest priority.
Better tell him and his family what's going on.
We're just gonna bring this in a minute.
After an agonising wait, Katu's family finally gets to see him.
Don't worry about that now.
Yes.
Don't worry about your clothes or anything. It's a bit hard to see him with monitors and everything cut off him and that. It's not what you really want to see your child, you know, so it's pretty tough. We wish this on no parent to have to go through what we've gone through. That's not good.
Going to MRI.
Dr. Jonathan organises further scans to try and figure out what's going on.
An MRI, that will be the test that will show us what does his spinal cord actually look like. We're not actually seeing any injuries. He's still got the weakness and we still don't really know why he had the chest pain and the collapse. So there'll be an answer and time will tell. But at the moment, we're not there. He's not out of the woods yet.
For now, Katu leaves the ED to have more investigations and wait for the results. It's been an unusual journey that led emergency nurse Peretz Kutnik to Royal Melbourne Hospital.
I come from a family of rabbis. My grandfather was a rabbi, my father was a rabbi. I actually went overseas to start religious studies to become a rabbi. While I was studying, I did a paramedic course, worked as a paramedic. And when I came back to Australia, I decided I wanted to do nursing. To make a big difference in somebody's life is huge.
The entire ED team make big differences in the lives of people.
Well, I'm receiving.
Every hour of every day.
Coming to you with a 55-year-old male with a left arm crush injury. Was trapped in a car wheel, which now with severe pain, down there's a tingling altered sensation and swelling to the left forearm down.
Less than an hour ago, admin worker Gavin was alone in his backyard when the car he was working on fell and pinned his arm.
Hi, Gavin. I'm Perrette. I'm one of the nurses. There's going to be a few of us here as well, OK?
Ready, set, go.
Is that the sore arm, the left one? Yeah.
So this is Gavin. Gavin's been changing a car tyre when the jack has slipped and his left hand has become entrapped. Trapped for approximately 10 minutes when neighbours have come to his aid and lifted the car.
Well, I was in my backyard. I heard a crash bang and the next minute Gavin is yelling out, "Peter, Peter, help me." So I whizzed around and the jack had collapsed. I quickly got 3 other neighbours to lift the car up so we can get his arm out.
If I didn't have people next to me, next door neighbours, I would have, I think, passed away tonight. I couldn't get my arm out.
Losing the use of his left arm is especially frightening for Gavin.
I can't use my right arm in any capacity. I can't even do my shoelaces up and recognise that I'm a minimised survivor, which makes it very, very hard to use that arm.
Gavin's mum took the anti-morning sickness drug thalidomide.
Doing really well, Gavin.
The notorious drug caused severe deformities, and Gavin's right arm was badly affected.
If I lose my left arm, it's tragedy.
Can you make a fist for me on that side? You can't. Can you feel me touching? It's reduced sensation, is it?
The seriousness of Gavin's injury has meant trauma surgeon Dr Rose Shakirian's been called to assess the damage.
On that side for me. Are you able to straighten your elbow?
As Rose is examining Gavin's arm, he can't move it, he can't feel properly, he's got decreased sensation.
What happens if I move it? Does it cause pain?
As I'm hearing these constant problems with Gavin's left arm, alarm bells are going off in my mind. I'm thinking, have nerves been affected? Has muscle been affected?
Are you able to move your fingers? All right. Can you squeeze my hand?
We know there's been a crushing injury. We know that there's been something serious. How bad is this?
I'm trying to move this arm.
Try not to move it, buddy.
G'day, mate.
Move your arm.
You're sore, are you?
Very.
Very sore.
A serious motorbike accident has left 24-year-old Michael with multiple broken bones and a bleed on the brain. Dr Martin's assisting Dr Terry to get his extreme pain under control.
What's the most sore thing?
This arm.
The left arm.
Right.
One of my jobs as an emergency physician is to train and mentor young specialists in training.
How much opioid has he had?
He's had 200.
200 of fent.
We're going to get rid of your pain. Going to get rid. Yeah, that's all right. Let's start working on it. I'm going to do a nerve block on this man.
They need to take the plaster off so Dr Martin can access his veins.
Michael's got a severely fractured wrist, so I'm going to inject some local anaesthetic.
Little sting.
Just below his elbow to make his wrist numb.
Ow.
You saw up here?
Ah.
As I'm moving Michael's arm, his elbow is not moving normally and it's quite uncomfortable for him. And that makes me worry that there's something going on with the bones or joint in his elbow.
So that's wrapped in local anaesthetic, which is good. He's snoring now.
I know. We had to sedate him to do it before.
Well, he's had 20 ketamine and now he's had some more local anaesthetic block and now he's asleep. That sort of says to me that perhaps this is effective.
Traction.
Yeah. I'm pulling.
Yep.
With the anaesthetic working, they can reset his arm.
Are we going for pain?
Yeah, he's okay.
Yeah.
Like, he couldn't tolerate this at all earlier, so, like, he's doing really well.
Magical.
Worried about unexplained pain in Michael's upper left arm, Dr. Martin wants more investigation.
We need to check out what's going on in that elbow.
We're nearly done.
His elbow's actually dislocated. It's popped out and gone back, and I think there's a little chip, maybe a bit of broken bone as well. Explains very much why it must have been complete agony for him.
Sorry, darling. Sorry, who are you? Are you his mum?
Is that Mum?
Okay, that's okay.
Yeah, she's right here, buddy.
Mama. Okay.
Yeah, Mike.
Yeah, come on,
Yeah.
of course. Oh, Mike.
Michael's mum Michelle arrives, unaware of his shocking injuries.
Hey, Mish. I'm Terry. I'm the doctor. You okay?
Yeah.
It's right. Slow down. It's okay. So look, it's going to be a long road to recovery.
Yeah.
But he's going to be fine, all right? Okay?
Fighting every motherly instinct to stay with her son,
We'll get you in as soon as we can, okay?
Michelle has to leave him in the hands of the doctors.
It's heartbreaking, you know. As a mum, you don't see a 25-year-old man on that, you know, on the hospital bed. It's like your little 5-year-old boy.
You've gone and popped your elbow joint out.
Oh, lovely.
Yeah. Do you want me to pop it back in for you?
Knock me out, pop it back in, should be right.
All right. Just slowly start moving it.
Yeah, sure.
So bring it into 90 degrees. Yeah. And push from behind up.
Oh, there you go. Got it.
Well done, team.
Thanks.
So the good news is at the end of your shift, after managing this patient from beginning to end, you are an emergency physician.
Oh, great. That's good to know.
This man has given you every problem to solve.
Michael's case is the worst motorbike accident I've ever seen. He's going to be admitted to ICU. He's going to require at least one procedure, if not multiple, and he's got a long road of recovery because there's going to be probably lots of issues with pain, mobility, and just getting him back to where he was before.
So there, Gavin. Yeah. Do you remember what happened today?
55-year-old Gavin was changing tyres on his car when the jack slipped, pinning his only good arm.
I had my fingers amputated when I was a child.
Yep.
Through thalidomide.
Gavin is in serious pain, and Nurse Peretz needs to control it with intravenous drugs. But there's a problem.
So I can't get access on the right side.
Oh, why?
Just nothing's showing.
We're struggling to find a vein. It doesn't allow us to administer quick pain relief to Gavin, which he desperately needs.
An ultrasound eventually shows a vein.
Okay, sharp scratch now, okay?
Doing really well, Gavin. How's the pain? 6 or 7 out of 10. We're going to do an X-ray and make sure everything's okay there.
The X-ray will reveal if 10 minutes of crushing has broken any bones in Gavin's arm.
He's just feeling a bit colder on the left arm and leg.
Does he have C-spine tenderness?
No.
It doesn't look like there's anything broken there. I think you've damaged the muscle.
With the team still worried about the danger to Gavin's arm, emergency Dr. Luke Delarue steps in to help.
Hey, Gavin. How you doing? I'm Luke. I'm one of the emergency doctors. I'm just going to have a quick look around, all right? Is it sore in through here?
The reduction in movement of Gavin's hand and the reduction in sensation tells me that there's been significant damage to the forearm. It could be direct trauma to the nerves that supply the function of the hand. It could be stunning of the nerves from the pressure in the wrist and the forearm.
What other medical issues do you have?
Thalidomide survivor, so...
Thalidomide, okay, yeah.
So I have my right arm and the hand.
Yeah.
Concave chest and internal injuries.
Okay.
And the heart too.
Did you have any chest pain or racing heart?
Chest pain on the left side.
Uh-huh.
Numbness with the arm.
Yeah.
All the way through.
Was it above the elbow or above the level of injury that you had numbness as well?
One of the things we worry about with crush injury involving a large amount of force or a prolonged period of time is something called compartment syndrome. It's where there's swelling within the soft compartments of the limb. It's a limb-threatening injury, and that can actually develop into a life-threatening injury as well.
Yeah. Has that gotten worse or is it about the same?
Around the state.
Dr Luke is with thalidomide survivor Gavin, who is still in a lot of pain after his only good arm was crushed under a car.
It's going to be pretty sore because there's at least a big hematoma or bruise in the muscle.
No break, no.
There's no big break that I can see, which is good. Can you wiggle your fingers for me again on this side?
Very sore.
In order to identify if a compartment syndrome is developing, we need to watch over a period of time. What Gavin really needs is a CT scan to make sure that there's adequate blood supply getting through the region of injury and down to the hand.
Resus 3 needs a pretty urgent scan for the chest and arm because of compartment syndrome.
Gavin's wife Lisa and neighbour Peter are waiting to see him.
So we're going to do a CT scan of both the chest and the arm because it's some chest pain as well, and just make sure everything is okay. So we'll know a bit more after that. Nothing's broken on the X-ray.
Lisa's here.
Yeah.
I tried to do myself swim. My arm get caught and I couldn't move with my right arm.
You won't be changing any more tyres?
No way. I'll never change a tyre again. I've learnt my lesson. Thanks for saying my life. That's right.
Come on, sir. We're going for a CT scan, okay?
A short ride to the CT scanner will go a long way to answering the team's concerns about Gavin's injury.
So the left arm is the problematic one. Thanks, everyone. See you.
Dr Luke gives Gavin the news he's been desperate to hear.
So look, the scan of the chest looks okay. There's no injury to the vascular structures or the blood vessels, which is good. We were worried about that given that your arm was kind of pulled and trapped. And the plastic surgeons don't think that there's a compartment syndrome, but they want to just continue to monitor that. And I'll put a cast on as well just to keep it nice and still.
Okay.
It helps with the swelling.
Over a period of time, that big bruise within the muscle belly will improve, and hopefully Gavin should return to full use of that arm, which is really great.
How's the pain?
It's probably back to 5 now.
Yeah.
And I'm not getting the numbness anymore.
Yeah.
And I can do that.
Good. Are you able to straighten through the elbow?
Just sore here.
Yeah.
Treating a case like this with Gavin is definitely one of those positives we talk about.
Is that comfortable enough?
Yeah, that's to see Gavin's face change from fear to elation when we tell him that we think his hand is going to be okay. It's a great part of your day.
It's unlucky.
Gavin's been given the all clear, but he'll still need to be kept in overnight for observation. Deputy Director of Emergency, Dr Steve Pinkus, is responding to a call for a patient with a serious heart condition. 61-year-old Richard has just been rushed in by ambulance.
Richard, good day. Steve's my name. I'm one of the doctors. How are you going?
Yeah, sort of okay.
So tell me a story. What's going on?
Today I woke up okay.
Yep.
Got dressed, I was going to do some exercises. Started not feeling 100%, so I stopped. Heart rate was at 69 and it accelerated up and settled at 120.
Richard has a very fast heartbeat. It can deteriorate into a more dangerous rhythm, and because the heart's working so fast and so hard, this could precipitate a heart attack.
The retired Human Services Manager has been brought to the ED with frighteningly fast heartbeats 3 times before.
Get a bit of a flutter in the chest, and that's the heart not beating correctly. And then the pain starts as the heart rate speeds up, it's going a lot faster than it should, and that hurts. If I don't monitor it and it gets out of control, the heart can stop beating. So, drop dead on the spot.
Richard's heart is still racing at more than twice its normal rate.
I can see that Richard's heart is beating very fast, but I can't tell, is this atrial fibrillation or a very similar and related condition called atrial flutter?
We'll take some bloods.
Yep.
Do an ECG.
Richard regularly sees a cardiologist at the Royal Melbourne.
I'll talk to John Coleman, and my suspicion is he'll say, do we mind doing a zap and trying to get you back into sinus rhythm?
Yeah, that'd be nice.
Sinus rhythm is the normal heart rhythm. What we're trying to do is reset the heart rate back to normal.
The procedure, called cardioversion, involves sending an electric charge through Richard's chest. But first, Dr. Steve needs to find out if Richard's heart is an atrial fibrillation or atrial flutter.
Between the top of the heart and the bottom of the heart, you've got a junction box. Yep. So what we're going to do is I'm going to give you some medication which, for about 10 seconds, it completely blocks conduction in the junction box.
Oh, okay.
Dr. Steve will stop Richard's heart for a few seconds so he can check its electrical activity and see if it's got an irregular beat called a flutter wave.
If that shows the underlying rhythm is flutter, then we'll pop you off to sleep properly and give you a zap.
Yep, no worries.
Okay. Let's find some bodies to give us a hand.
The critical nature of the procedure means emergency nurses Jenna Orman and Liz Wheeler join the team.
Now, Richard, you share with me, you wear the full bear suit.
Shave away to your heart's content.
We're going to give him a medication called adenosine that temporarily blocks the conducting system of the heart.
It's going to give you a little bit of sedation now, okay?
The heart literally looks like it stops beating. Then as it recovers, we can see if it was what we call flutter. You right, Richard? Okay, so let's start with 6.
Adenosine 6 going in.
It's a nervous moment as Richard's heart slows and stops.
There it is.
Oh.
It's flutter.
Yep.
When I've stopped Richard's heart, it feels like time has stopped for me. I'm anticipating what's going to come next. Yeah, he's gone straight back into it. How you going there, Richard?
Weird.
Not too terrible?
Not too bad, not too good, but
yeah. Yeah, okay. Gone now?
Lessening.
Yeah, good. Okay. So that confirmed exactly what we thought. You have a flutter wave underneath. We now need to go on to sedating him and, in layman's terms, zapping him to put the heart back into a normal rhythm. Okay, everybody's ready?
Yep.
Richard, you know you understand what we're doing? Every time you sedate someone, every time you zap someone, you have in the back of your mind, what if something goes wrong?
Starting to feel a little bit tired there?
You're taking someone's life in your hands, effectively. So we're going to give you sedation. You'll get that garlicky taste in your back of your throat and that slight sort of sting in the arm.
50 of propofol.
Sedation is by far the most significant risk here.
Starting to feel a little bit tired there?
The risk to his airway and his breathing. How you going there, Richard?
Happy?
Yep.
It takes only a few seconds for the machine to ready before it delivers a precisely timed shock.
Yep.
It's
Good.
synced.
Good, thank you.
Charging.
Okay.
Stand
Yep.
back. Shocking.
Flutter. Back to sinus rhythm.
Our heart rate's dropped a little bit.
Yeah, I think he runs a pretty low heart rate normally.
The electric shock works. Richard's heart has gone back into a normal rhythm.
Beautiful. Let him wake up and see if he's going to stay in it. Oh, Richard, big breath.
Richard, can you hear us? He's still breathing.
Richard's taking longer than usual to wake up.
It's just shallow. Richard is not breathing as well as I feel he should be. I think he is very sensitive to medication. No, he does obstruct.
Still requiring a jaw thrust.
And finally,
How you going, Richard?
he's breathing.
Good stuff. Make sure we'll put a note in his history for future.
Yeah, but he's very sensitive to
Very
medication.
sensitive to sedation, yeah. Richard has some underlying damage to his heart muscle, and that makes him much more prone to, in particular, atrial fibrillation, but other arrhythmias. And so I expect this won't be the last time he needs to be defibrillated.
But for now, Richard's heart is back in rhythm.
Oh, a hell of a lot better. It feels, with the heart now back at a fairly normal heart rate. There's no pain in the chest. I don't feel unsettled. and yeah, it's back to normal. So yeah, time to go home.
Schoolboy Katu collapsed on the rugby field, suffering breathing problems and chest pain.
So suspected spinal injury, just be careful.
Dr Jonathan was concerned the 18-year-old had broken his neck.
Very worried about this boy.
The CT scan cleared Katu of a neck injury, but didn't solve the mystery as to why he collapsed.
This guy's challenging my clinical acumen. Why does it hurt?
It's just good to see you up and about, and hopefully we can get the answers that we need.
Katu was sent to a ward for further investigations. He spent 3 days in hospital and continues to have tests. Katu's hoping to be back playing rugby with his mates very soon.
My biggest worry is hopefully getting this sorted so that I'll be able to go back to sporting and be able to do the things that I love to do.
Hi, Gavin. Is that the sore arm, the left one?
Gavin's left arm was crushed by his car when the jack slipped as he was changing a tyre. The thalidomide survivor feared losing the use of his only good arm.
It's fine, but does it cause pain?
CT scans showed acute bruising with no permanent damage. Gavin spent a night in hospital recovering.
I can move my fingers now and there's no tingling, and about 90% back to full use, which is amazing.
The 55-year-old has promised his wife Lisa he'll never change a tyre again. 61-year-old Richard was rushed into ED with a racing heartbeat.
There it is. It's flutter.
Dr Steve diagnosed his heart as being in atrial flutter.
Charging.
After being sedated, Richard's heart was shocked back into a normal rhythm.
Shocking.
And he was able to go home the same day.
1, 2, 3.
24-year-old Michael suffered multiple fractures when his motorbike slammed into a van.
Pelvic fractures? Oh.
CT scans also revealed a bleed on the brain.
Yeesh. Michael's case is the worst motorbike accident I've ever seen.
Michael had many operations to fix his broken bones and is now back at home being looked after by his mum.
Royal Melbourne receiving, go ahead.
Just got a major trauma which want to bring in. Bill at work today when a approximately 500 kilo truck axle was landed on his right elbow.
Thanks, Point Cook. We'll see you in 20 minutes. Royal Melbourne out.
Paramedics are rushing in 29-year-old Billy, a heavy diesel mechanic.
It's got to be trouble. Anything industrial, it's always trouble. Hi, how you going? This is a gentleman who's had his arm squashed. We'll get to it. Pretty sore.
It's more just I need to straighten my arm out.
Yeah, and you can't?
Yeah.
It is still bleeding because he keeps doing that.
I apologise for the dirty sheets.
All right, we're going to make you do the washing.
We'll do the handover if you're ready. Yep.
This is Bill. Bill was working underneath the truck, looking at an axle, and it has fallen, landing directly on his right elbow, approximately 500 kilos. They've craned it off him straight away. One of his workers said he did see some spurting. Paramedics that arrived on scene.
No arterial bleeding. Yeah.
Just got some numbness tingling in the fingers.
Okay,
Other than
so
that, good movement. Got a peel
normal
pulse.
neurology. Yep. Thank you.
Feel better,
Yes.
Bill?
Thank you, lady.
So the axle landed on this bit or this bit?
Like right in the crevice
Right,
of the elbow.
right in the crevice of the elbow. Yeah, yeah.
So it's a flat plate, but
yeah.
it's got 2 bolts on the front and back.
Okay, yeah.
And the bolt was what?
Did the bolt dig in?
Yeah.
Yeah.
Can you feel me touching you here?
Yeah. I
Yeah.
can feel you
Can you feel
touching
this?
me. Yeah.
You go like this for me. And hold it fast as you can. Good. And like this. Strong as you can.
It was definitely a bit of a pancake, but
Yeah, and you've got a big cut. Well, why don't we give you a shot of something and then we'll unwrap it. We'll give him some fentanyl and then we can have a look at his arm. What I'm worried about is anytime you get that much force going through a limb, you can break a bone and you can cut a nerve or bruise a nerve. Because if the nerves are damaged, it's much more serious.
Peeling back the bandage reveals an alarming wound.
The dressing comes down, there's a lot of blood. Yeah, you've done some damage there. You put pressure on it, I'll get it. So it looks like he's hit some venous structures in the cerebral fossa, doesn't it? There's quite a lot of bleeding. If you hit an artery, then usually the blood spurts across the room. It's not doing that. It's bleeding like a vein bleed. Can you move it?
I can move it. It's just tender.
Yeah. All right. And what about that?
Tender again, yeah.
So it's probably going to be broken. Yeah. Have a look.
If you're here, you gotta put your arm down for us. Sorry,
So that's the two things that dug in, yeah? Yeah. You just got to rip it open.
Yeah.
Yeah. So we're going to get a photo mainly so that the plastic surgeons can have a look. And we can transmit that straight to the surgeons who are in the operating theatre so they know what we're dealing with. It's trouble.
How much is it going to much of it?
Well, not much, actually.
That'll be all right.
No, it'll be all right.
Can I get a photo?
Well, we'll get you the photo. Souvenir, yeah.
Yes.
Happy with photos? Yeah.
With such a deep wound, the risk of infection is extremely high.
What about tetanus? Do you know when you last had a tetanus injection?
Probably when I left the army.
Yeah.
2018.
Oh, okay. So you'll be covered. Yeah. What did you do in the army?
I was a plant mechanic.
A what, sorry?
A plant mechanic. Like a
okay.
diggers,
Yeah. So you saw like action or something in the...
Oh, done enough.
Done enough, yeah. He's an army guy, so he's probably seen some stuff. And I guess when injuries happen, you just have to get on with things. So I can feel pulses, right? Do you still have numbness or tingling in your hand, or do you not have that?
Tingling in the fingers?
Tingling in the fingers. So I guess with that, it might need to be explored. So if we can feel the pulse downstream, there's blood flow going down there. If you lose the blood supply to your arm, you could lose your arm.
Where's he going?
He's going to trauma 1.
Thank you.
The emergency team is on high alert.
Are you team leading?
Air ambulance has arrived from country Victoria with a critically injured council worker.
Thanks for coming down.
Emergency Dr Michael Dunn gathers a large trauma team.
Okay, well, I'll do the fast if you like.
Yep.
Even calling in the experienced hands of the Director of the Emergency Department, Dr Mark Putland.
In the badly injured patient, there's a few immediate life threats that we can make a difference to really in the first few minutes of care. But that requires a huge team of people to descend on the patient and to all act together.
Okay, team. Guys, stay quiet for a second. He's coming down the corridor. I'm very worried the noise will be loud here, so I don't want you talking unless it's absolutely necessary, okay? Trauma, or you're going to do our primary, you're going to do our fast scan. Gavin's taking the airway, and then we'll get X-rays and check vital signs, okay? But I want silence during the handover if possible, so we all hear the story of what's going on. Hi, guys. Any change since you called through?
No. He's been persistently tachycardic, but his blood pressure's always at 150.
Okay, so stable. You're happy to transfer?
Yeah.
Then do handover? Yeah. Okay. Okay.
The patient is 42-year-old Bradley, a husband and father of 5 young children.
Might just get a dedicated person to the leg as well on the transfer over.
Without warning, his truck careered off the road and slammed into trees.
The really big immediate life threats are loss of airway, injuries inside the chest causing leakage of air or blood from the lung that eventually can crush the lungs and crush the heart.
Okay. You happy doing the handover?
Yes, absolutely.
Yeah.
So this is Bradley. He's been driving, restrained driver of a semi-trailer, driving along a 100-kilometre-hour road. Other motorists have seen him swerve, and then he's gone through a barricade, down through a ditch, and into a whole bunch of trees. He says he blacked out, can't remember any of the incident, and it looks like he's got a right femur fracture.
Okay, thank you.
One of the commonest things that causes someone to black out is a arrhythmia of the heart, where the heart stops beating as it normally should do.
So you had a good view?
We're looking for signs and hints of something more serious.
Take a deep breath for me.
Bleeding into the chest is Dr Mark's immediate concern.
There's a rib.
And the tummy and heart.
Yeah, that's good. That's negative. Good.
Between the lung.
It's hard. Push over. Yeah, good. Other side. Yeah, good. There's lung slide. Good. Done. E-fast negative? Yes, E-fast is negative. Excellent. So let's get bloods, including police blood. On top of the trauma bloods, let's get a troponin as well.
My biggest concern with Bradley is why did he pass out in the first place? There's something wrong with his brain or heart that's causing this, and that's the unknown.
Now, I just want to quickly ask you, do you remember moments before you crashed?
Do you remember in any way feeling unwell?
Yeah, well, this morning I thought, I had a bit of a cold.
Yeah. And when you were driving, did you feel dizzy or did you feel
No,
unwell?
I just blacked out.
So you felt perfectly fine?
Yeah.
And then suddenly, next thing you remember, you're...
In someone talking to me.
Okay. But you weren't confused for a long period of time, no? Okay. Let's get some portable x-rays and then we'll log roll and then we can get a CT afterwards.
Hold your breath for me.
X-ray. I think we factor in the time to get here into how sick he is. I mean, the fact he's been 2 hours stuck in that truck, there may be injuries that haven't been treated for some time. So we just have to be a little careful and take our time.
So he's got a fracture through the middle here of the thigh bone, the femur, and also a chip here. Yeah, it's a pretty bad break. Anything that involves your weight-bearing bones is going to be serious and likely need an operation.
We're going to roll you to one side.
The team need to check Bradley for spinal injuries.
I'm going to poke down your back and I want you to tell me if it hurts. Then we're going to check the sensation just near your butt cheeks as well.
Okay, team, we're going to roll on 3. 1, 2, 3.
Okay, that's good. Pain here where I'm pressing.
Yes, fucking lots.
Here where I'm pressing. Yep. Here.
Yep.
Here.
Yep.
Here.
Yes. Oh, hang on, no, sorry.
Okay, where
That's
I'm
my
pressing.
leg that's sore.
I know. On the back where we're pressing, is the back sore?
No.
Posterior thighs, okay.
Sorry, I was getting confused.
No, you've done well. Okay, we're going to roll back on 3. 1, 2, 3. Stay still for me, mate, here. Stay still. How's your pain right now out of 10?
Your leg's freaking sore.
Do you want some painkillers?
Yes, please.
Yeah. We're going to put some local anaesthetic into around the groin area to numb up that right leg for you, okay? You've broken the thigh bone midway through. That one needs to be fixed. I'll put a rod through that to fix that, okay? But this will keep you numb for about 12 hours, so you're not in pain, all right?
Let's just get in here, make the man comfy. G'day, my name's Mark, one of the many doctors. All right, thank you.
Just me, or is there a lot of Irish doctors?
Oh, Irish, English, all sorts here.
Yeah.
Hi, it's Michael here in Trauma 1. How are you guys going from a CT perspective for our trauma guy? 5 minutes, short. Cool, thanks. 5 minutes. How are you feeling? You okay?
Yeah, not bad, mate.
We're gonna get you around for a CT scan. Obviously, we've got the leg injury and we've got the wrist injury that will both have to be looked at. But the other thing we're gonna be doing while you're here is working out what happened that caused you to pass out and crash.
Yep.
That's gonna be part of your workup as well.
Yeah.
I know it's probably, you said you don't remember anything. Wasn't an intentional thing, was it?
Absolutely not. No.
Good. Have to ask.
It can sometimes be a bit confronting asking someone in a car crash whether it was intentional or not. And that's something that you'd often think about, but we do see it from time to time as a form of a suicide attempt. And I think it's important that we don't ignore the uncomfortable questions because they're uncomfortable, and that we're treating whatever condition needs treating, be it physical or mental.
Do you have any family that know you're here or want to know that you're here?
That's probably here.
What's her name?
Somewhere, Christy.
Christy.
What was it, 16? Yeah, wedding anniversary last week. So yeah, married me childhood sweetheart. We'd been together since I was 16, so.
100% the worst call I've had. We have a very busy household. We have 5 children, so, you know, how quickly that could have been taken away from us.
Bradley's work future is uncertain.
You know, Bradley's a driver by trade, but I need to figure out why he's collapsed in the first place, and is that going to happen again? And if he has something like a seizure, or if he's had a funny rhythm of the heart, that might prevent him from working again.
And then we'll need to do some tests to figure out why you passed out in the first place. Because that happened, unless we have a very clear-cut cause, you probably won't be able to drive for a while.
Yeah.
Let's dug into the tissues.
29-year-old heavy diesel mechanic Billy has a horrific injury. A semi-trailer axle weighing 500 kilos fell on his arm.
Don't think it's hit the artery. The bone might be involved. If the bone's involved in an operation, but it's just going to depend on the x-ray. Do you still have numbness or tingling in your hand, or do you not have that?
Tingling in the fingers?
Tingling in the
everything else
fingers.
is fine.
All right. The tingling in the fingers means he's got nerve damage. So if the nerves are injured at the elbow, you can certainly lose the function of your hands. Then he might not be able to work again. He's a mechanic. He needs to use his hands. Let's just do the plain X-ray and see what it looks like. We might need a CT of the elbow, depending on what the X-ray looks like.
Mind if I try and make a quick phone?
No, by all means.
Trying to call my partner just to... I don't want work to call her before I get through to her. I'm all right, I'm good, but I'm in hospital. All good,
I just got a call from Billy and he said he had a little work accident. I don't quite know what to think, but you don't really get taken to A&E for no reason. I'm just very confused because talking to him, he sounded fine, but I know he's a very strong person who likes to downplay things sometimes, so I'm trying not to freak out.
X-rays will help determine the extent of his injury.
So, cunningly hidden underneath the bit of surgical dressing, there looks like a little problem here. Maybe a little crack in the medial epicondyle, which would make sense. The way he can't extend his arm suggests that there should be a fracture, because he can't extend. Whenever he extends, it hurts. We're going to get a CT. That'll sort this out.
While Dr Jonathan organises the scan, emergency nurse Tabitha checks on Billy.
Can you lift this arm up for me? Let's see where it's bleeding. It's bleeding under there.
And raises the alarm.
Oh, lots of blood.
Yeah, we're going to open it.
Has it just started bleeding?
No, it's just been slowly...
Oh, it's been slowly oozing, has it?
Yeah.
I'm Emma. What's your first name?
Billy.
Billy.
Yeah.
A 500-kilo axle collapsed on Billy's arm while he was working on a semi-trailer.
OK. And then you haven't had a CT scan or anything?
Emergency doctor Emma West has been called to urgently help.
You can feel me touching across your hand. Good return. I can see that he's bleeding through the bandage around the front of his elbow, and that's where the brachial artery sits. It is a major artery that then supplies all the muscles, the bones, the nerves from the elbow down in the forearm. And it's absolutely vital to the function of your hand. It can bleed high volumes, and that can threaten Bill's life.
Dr Emma raises the alarm with Dr Jonathan.
He's got a big wound, and it's bleeding. He's got what? Oh, has he? Well, he's bleeding through that. OK.
So you're bleeding underneath?
Yeah. You're going to take it off and then reinforce underneath?
Yeah. There's a lot of blood. This looks like a lot more bleeding than there was before. So has the artery started to bleed?
What, is that your shoulder hurting or your arm?
So was there an arterial injury that was kind of spasm and now it's just popped open and started to bleed? Is that what's happened? Maybe things are worse than what we thought.
There's nothing pulsing out, but you can see the pulse of the brachial artery.
Called gravity.
Can you see that?
Gravity's our friend. Yeah. There's the brachial artery pulsing away. It's there for us to see. Just actually.
Oh, that's really sore, isn't it?
Oh, yeah.
I'm going to do a really tight one just over the first top. Sorry for that. That feel tighter?
You can bend your elbow just a little bit. Yeah, that's great.
Can you just make sure there's a nice little pulse there? You can see his brachial artery pulsing in there.
I know. But see how the puncture marks went either side of it?
Yeah.
Right here, how does your hand feel? Does it feel any different? No.
Then it's the two fingers.
Yeah. Work it out. You definitely have a fracture there, though. Let me just double check your pulse. We've felt his pulse a few times, and the pulse down at his wrist is not as good as it should be. But if he's damaged an artery and he loses blood supply, he could actually lose his hand through lack of blood supply. So we're going to do a CT angiogram, which will give us a picture of the artery. Can't get to CT fast enough.
Obviously, we've got the leg injury and we've got the wrist injury that will both have to be looked at.
Dad of 5 Bradley has a badly broken leg after his truck careered off the road and into a tree.
So look, we'll get you around, we'll get the scans, and then we'll need to do some tests to figure out why you passed out in the first place.
I just can't believe I'm here and I can't believe it happened. I was a bit sort of off colour. But yeah, next thing, I'm bloody shitload of trees with no roof on the truck.
Now, we're going to bring you around to our CT scanner, OK? They're going to give you some contrast, which is basically dye that they inject in the veins to see the blood vessels. It gives you a really warm, flushed feeling and makes you feel like you've just weed yourself, OK?
Rather than actually leave.
A scan of his brain may solve the mystery of why he lost consciousness.
So we're in since hospital.
You're in Royal Melbourne Hospital. It's top of the CBD in Melbourne.
We're not only looking for traumatic injuries from the crash, but we're looking for causes of him to collapse in the first place as well. What I really don't want to see for Bradley is injury to the blood vessel leaving the heart, and in particular, no bleeding in the brain.
Oh, hey, it's Michael here in emergency. We have a trauma patient he's absolutely no recall of the event, and we're concerned about a seizure. His brain scan looks fine to us.
While the brain scan is clear, Dr. Michael still needs to find out why Bradley blacked out.
It's more, I don't want it to be postponed and then so far from the event that it's not accurate. And given the impact it's going to have on him. But I'd like it done. If a seizure is considered to be a possibility as to why he actually crashed the truck, it can have pretty profound impact on his life. Like if someone who drives a truck, for example, you can be years without being let behind the wheel.
Who's your next of kin?
Christy, she's a hairdresser, but she was at work today, so someone would have like half a haircut, I'm sure.
Christy, Bradley's wife, can finally hold her husband.
Hi, how are you? I'm Michael, I'm one of the emergency doctors looking after Bradley. You okay?
Yeah, hi.
Yeah. The other thing we need to figure out is why he passed out in the first place, and that's going to be a separate line of investigations, looking for things like seizures or funny rhythms of the heart and those sort of things. But I suspect that'll be the plan. All right, but look, I'll keep back and keep you updated, all right?
Bradley's got a bit of a course ahead of him. He's got to recover from his leg injury, but on top of that, it won't just be about physical rehab. We're going to be trying to figure out what caused him to crash in the first place. He can go home safe knowing that it's not going to happen again.
Oh, right. Okay, you got your
Nothing
present.
to see here.
That's your pay for today.
Cobram peaches.
So you could just go home and get them.
It's a long way. It's a 3.5 hour drive.
Don't you go there every second weekend?
If you show me respect today, I'll leave one on your desk for you.
You'll leave one on my desk for me.
Leave one on my desk.
Just leave it on the desk and I'll assume it's for me. Outrageous. The shared desk.
Just across to the other bed now, Colin, okay? On go, ready, set, go.
In Trauma Bay 2 is a 71-year-old bike rider who's been involved in a serious collision with a car.
We're just gonna give you some oxygen as well, all right? Yeah.
So this is Colin. He's been riding his bike today when he's been hit by a car. He's got a compound fracture to his left ankle. He's got some slight reduced sensation and some numbness to his left foot.
Taking the lead is emergency doctor Luke Delarue.
Hello.
Hello.
How you doing?
All right.
I'm Luke. I'm one of the emergency doctors.
Good. G'day, Luke.
You've done a good job of your ankle, by the looks of it.
Car did a good job of it, yeah.
Yeah. Do you have any pain anywhere else?
No.
How fast were you going?
I don't know, 15, 20 kilometres an hour.
I'm not a bike rider. I've worked in a trauma centre for too long to ride a bike, particularly in the city.
Do you think your leg went underneath the car or you landed awkwardly on it, or it's hard to say?
It's hard to say. I think I didn't go under the car at all.
Yeah, okay.
In any way.
Yeah.
Paramedics have identified that Colin has what looks to be an isolated injury to his ankle, and they've described that as a fracture dislocation, which means there's significant damage there.
So you cycle a lot?
Yep, try to, yep.
Each day, or?
Not each day, but yeah, two or three times a week, yeah.
Still more than me. And does your wife know you're here?
I don't know if she knows that I'm in this hospital.
Okay, I will give her a call in a minute, okay? Did you lose consciousness or you remember?
No, I didn't lose consciousness. I looked down and I thought the whole foot had come away.
Yeah.
Colin's concerns that he's lost his foot are very real. His ankle doesn't look like the shape that an ankle should look, and so we know there's significant injury underneath there.
We'll have a look now. Can you wiggle this toe?
Yeah.
Good. You can feel this?
Yeah.
And this?
Yeah.
What about up here?
Yeah.
The main issue in a fracture is that we worry that there's compromise to the blood supply and to the nerves to the foot.
I'm just testing the blood supply.
Just having a feel of your pulse there, Colin.
Feel it?
We need to identify whether a pulse in the foot is present,
No.
because if there's not, that's a limb-threatening emergency.
29-year-old mechanic Billy is about to have a CT scan after a 500-kilogram semi-trailer axle collapsed onto his elbow.
So has he actually got an injury to the artery there? The angiogram will tell us. The worst case scenario is you do injure the artery and the nerve, and then the blood supply to the hand is no good and your hand doesn't work properly. What we're hoping not to see is damage to the brachial artery.
Billy's partner Hillary has made it to his bedside.
You okay? Oh my God, you're leaking.
This wasn't part of their plan when they came to Australia to build a new life.
We've been together for, I think, almost 2 years now. It's the first time I got a call like this. It is a little bit scary, yeah.
Billy will be having surgery. How complicated will depend on the final CT results.
Ooh. Yes, there was an artery injury. Here's the artery. There. The artery's not supposed to stop there. The artery's supposed to connect. The brachial artery has been transected, i.e. cut in half, and there's a gap of 6 centimetres missing from the artery. So he's going to have a more extensive operation where they need to repair the blood vessel and repair the bone and repair the tissues over the top. Pretty extensive surgery.
As he heads to the operating theatre, Billy and Hillary face an uncertain future.
If we couldn't repair the nerves or things were irreparably damaged, then he might not be able to work again.
I'm just testing the blood supply.
71-year-old bike rider Colin has a badly broken ankle after a serious collision with a car.
Feel it? I don't think we ever feel it's real.
To have a chance of saving Colin's foot, they need to find a pulse.
Oh, I got a pulse.
Let's get an X-ray.
With a pulse confirmed, there's hope his foot can be saved.
Are you able to angle one down and just like this? It'll just helpful, just something that'll give us more information.
X-ray.
Let's get a couple more pictures of that foot, okay?
X-ray.
They'll soon be able to see just how bad the fracture is.
Yes, that's exactly what I want. Yeah, thanks. So he's displaced sideways, but he's also, this dome should sit underneath here. So he's not just fractured there, he's dislocated there, and he's knocked this part off. So he's blown both sides out, which is why he's dislocated. Yeah, so it's an open fracture dislocation, so the risk of infection is very high.
When the bone is actually protruding outside of the body, bacteria getting into the wound can be really problematic.
It needs to be rapidly cleaned, rapidly reduced, and then splintered. So it is broken and is dislocated as well.
Oh, okay.
So the concern is it's an open fracture dislocation.
Right.
The priority right now is to get it as straight as possible.
Yeah.
To restore the blood flow to the foot.
All right.
All right?
If we don't do that in time, complications of that can be really significant, up to and including amputation of the foot itself.
So we're going to take it down, have a look, give it a wash, pull it straight, put a temporary cast on.
Yeah.
And then you'll probably need an operation at some point to fix it.
Okay.
Okay?
Yeah.
Medication I'm going to use gives you kind of vivid, funny dreams.
Yeah.
So you get to choose your own adventure, have a think about something nice.
So this is a really painful injury. So the best thing for Colin in this case is to perform procedural sedation. So that's giving him essentially like a light anaesthesia so that he's not aware of the pain and so that he's not aware of the procedure that we're about to do to realign the joint.
Nice, yeah. All right.
The happier the thoughts, the happier the experience will be.
Yeah, sure.
Okay? Yeah, we'll be here the whole time with you.
Okay.
I'm going to give him a little bit of ketamine now as analgesia just to see how he responds. Yeah.
There's a number of things that can go wrong. We always worry about maintaining the patient's oxygen levels, maintaining the patient's blood pressure,
That's another 50.
And there's always that risk with too much medication that the patient can stop breathing completely. And so we need to be very close by in a very controlled environment to manage these risks.
It's just a little bit of that medication as a taster, all right? So you might feel a bit warm and funny. You okay?
Starting to get there.
You can close your eyes, think happy thoughts.
Yeah.
Almost ready, I reckon.
Orthopaedic surgeon Dr Shun can now begin the job of saving Colin's foot.
Over here.
As the bandage is unwrapped, they finally see just how horrific the injury is.
Wow, that's impressive.
It's a really serious injury. The foot actually looks like it's partly detached from his leg.
Just a few hours ago, passionate cyclist 71-year-old Colin was enjoying one of his weekly rides. Now, doctors are trying to save his foot.
I can see a really significant laceration extending into the ankle joint, and I can actually see the lower part of the tibia protruding out through the wound.
Pulling the bones back into place would be excruciating, so Colin needs to stay sedated.
Look straight here.
This is a crucial moment as Dr Shun attempts to push the bone back in and realign the foot.
Open your eyes. Doing well. You okay, Colin? Doing well. Does it feel a bit more stable than anticipated?
Clocked back in. It's going to be unstable, but we'll see.
How you feeling, Colin? You okay?
No.
You're doing really well. You're in hospital, you're just waking up, okay? Just done a little procedure on your ankle, okay? But it looks nice and straight. Looks like the way an ankle should look, which is good.
Is my wife here?
I'll go find her in a second, okay?
Colin's wife Linda and son Tim can finally see their loved one.
I didn't knock anyone over here. When I looked down, it looked like my whole foot was attached to the bottom of my leg. No, when they did the foot, I thought I was in a Stanley Kubrick movie.
No, you were out of it.
I sure was.
Even though the alignment is back to normal, there's really none of those pre-existing structures that hold the ankle in place. So he's still got 2 broken bones. He's still ripped through all of the ligaments that hold the ankle together. It really is like a bag of marbles until the operation occurs.
I'm take you around for your scan. Okay.
And then the orthopaedic surgeons will place some metal rods and screws to help fix the fracture and the ankle joint back in place. It'll be a really quite a long time until he's back doing the things that he was doing before.
Dr Michael's next patient has arrived. 81-year-old Judith has been rushed into ED with an extremely high heart rate, almost collapsing after running errands.
How far away?
I thought they were similar times.
I'm happy to look after this. I'll give you a call when you have. Okay, I'll go see Judith now. Hello.
Hello.
Hi, how are you? Michael, nice to meet you.
Are you a nurse or a doctor?
Doctor. So, what's happened today?
Everything.
Yeah.
Yeah, drama.
Yeah.
Just needed a bit of attention, I think.
Well, it worked.
I felt very second-hand all day.
In what way?
I was really shaky, really shaky, but no chest pain or anything.
So you felt ordinary today?
Yes.
Tired and shaky and not
Yeah,
quite right?
Yes.
Sure.
I live alone, so
You don't want to go home until you're well and safe?
no.
Exactly.
So I thought I'll get the Omron machine out and check blood pressure. When the pulse rate was 138 or something,
Yeah.
and it's mainly 77. And I did it again, and of course that set me probably into a bit of a panic.
I say so, yeah.
Judith's no stranger to hospitals. The retired pathology nurse not only has a troublesome heart, but has survived cancer.
How do you feel now? Much the same?
I feel a bit nauseated. You haven't given me anything yet for the nausea, have you?
I just charted some stuff. We're going to grab some stuff. Here we are. On cue.
Thank you, darling.
I didn't want to ruin the shot.
Can't believe this. Where's Brad Pitt?
You've got your own Brad Pitt.
Yeah, it's not real
There you
bad.
go. Yeah. You're Irish, Brad Pitt.
Are you Irish?
I am.
Oh, gorgeous.
When she liked me to Brad Pitt, that was a bonus. Kudos, and she's going to get extra special care, of course.
Have you had this before?
What?
The shakiness and...
Never
No.
that pulse rate like that. I have got a top cardiologist, and he looks after my heart. I've been really frightened today.
When your heart's going that fast for that period of time, it feels like something's terribly wrong.
Close monitoring confirms Judith's blood pressure and heart rate are way too high.
So it looks like from the ECG that the top part of your heart is fluttering. So normally it's meant to kind of beat regularly, keep the rhythm going.
Yes.
And instead of having a nice rhythm, you're having a bit of a techno party in your heart, and it's going really fast, and probably why you feel a bit tired and run down.
Right.
Because your heart's going so quick. So we'll do some tests to see why you're in it. Is there anything going on? And we'll go from there.
The worst case scenario for Judith right now is that her heart continues to go extremely fast. And because she has a degree of heart failure, it just can't keep up. The muscles gives way and really push her into heart failure. She's worried that she's going to die from this. I'm listening to Judith's heart and her lungs. I want to make sure she doesn't have a fluid gathering on her lungs, difficulty breathing.
But if you feel unwell at any stage later on, let us know. We'll get an X-ray and I'll come back to you, okay?
Thanks.
No worries, not at all.
Hello. Hello. My name's Ashley. I'm going to take you for an X-ray.
I want an X-ray to confirm that there isn't fluid in the lungs. And make sure the size of the heart's okay. It's not bigger than it should be. There isn't signs of decompensated heart failure is what we call it. It's when the heart failure gets dramatically worse.
I'm looking forward just to make sure there's no fluid in the lungs. You look to see any patchy kind of white stuff in the lungs, which we're not really seeing here. She's got a big old heart, so it looks pretty normal for her, I'd say, and normal to me.
Even though the X-ray of Judith's heart is clear, Dr. Michael needs to deal with the ongoing risks of her racing heart.
Now, whenever your heart's beating like this and not kind of in a coordinated fashion, you're a higher risk of developing blood clots as a result. So we're going to give you some blood thinning medication to try and reduce that risk.
Okay.
And the reason we do that is, firstly, as I said, to reduce your chance of clots. And it also means that if we do eventually have to do something about the heart, if it doesn't settle down with medications, we can give it a bit of a zap.
Okay.
To get it back into a normal rhythm.
If we don't get on top of this heart rate, she will go into heart failure and her heart will give in.
I went to see my specialist about the breast cancer, for a checkup.
Yeah.
That's in remission.
Yeah.
And he said, this won't take you out.
Yeah.
Your heart will.
Not this time. All right. No.
Not on your watch.
Not on my watch, no.
Okay. You're a charmer.
Okay, I'll take care of you tonight, Jude, all right?
And you're back in the morning.
No.
Righto.
No. I'm running away at about 1 in the morning.
Uh-huh.
But I'll leave you in capable hands.
All right. I'm
All
sure
right.
you will.
I will.
Lovely to meet you.
You too.
Gorgeous thing. Look at the eyes on that.
You're getting away with a lot today, aren't you?
I spoke with Judith's cardiologist, who knows her extremely well, knows her heart extremely well, and we keep Judith overnight for some observation, and in the morning time get her transferred to a hospital where he works.
I'll see you later on if you need me, okay? But I'll get you something to help you sleep tonight as well, okay? All right. Take care. No worries.
Have you just grabbed my things?
That's mine.
That's mine? Hey, that's mine. Take some pictures in my bag.
No, it's good for TV. I want to walk around with a picture of me, Emma. That's important.
There we go. Off I go home.
Try out again. No, just...
Okay, team, he's coming down the corridor.
Husband and father of 5 Bradley was rushed to emergency with a serious leg injury after he crashed his truck into a tree.
Did you feel dizzy or did you feel...
No, I just blacked out.
Dr Michael was worried he may have had a seizure.
I want you to do some tests to figure out why you passed out in the first place.
After 2 operations on his leg and a month in hospital,
Refreshment?
Thanks, Chris.
Bradley is recovering at home
Kids will be stoked.
Yeah, no, they're hungry little buggers.
with his childhood sweetheart Christy and his young family.
I can fully weight bear now on that leg. The metalwork's all healing well and everything seems to be going okay. They still haven't worked out why I blacked out, so I've still got to see some specialists.
I ain't my foot.
Yeah, so I am back at work. In the office a bit at the moment, just generally trying to get back into the swing of things. Honestly, I'm glad I didn't die, obviously, but I'll just be glad that, when I can actually walk, it'll be nice to be able to do just simple things.
On go, ready, set, go.
Keen cyclist Colin was rushed to emergency after colliding with a car.
Did you lose consciousness or you remember?
I didn't lose consciousness. I looked at the ground and I thought the whole foot had come away.
Dr Luke was worried Colin's foot would have to be amputated.
The foot actually looks like it's partly detached from his leg.
A day after surgery, Colin was able to go home.
They fixed that up and then they straightened the broken bone. It's all stainless steel plate and screws that I've got in the leg now to hold the broken bone together.
Despite the accident, Colin is back doing what he loves.
I've been able to get back on the bike since the accident. Short distances, of course. Cycling gives me a certain amount of freedom. It means I get out into the fresh air. It helps me to exercise. The care at the Royal Melbourne was fantastic. Yeah, I couldn't speak more highly about it.
81-year-old Judith almost collapsed running errands and was rushed into ED with a rapid heart rate.
I've been really frightened today.
Dr Michael was worried Judith would go into heart failure.
The top part of your heart is fluttering. You're having a bit of a techno party in your heart and it's going really fast.
After being kept in overnight, Judith was sent for further care to a place where she's very at home.
I'm transferring from here to a hospital I worked at for 30 years. They're a good crew here. They looked after me and were very friendly. Beautiful. See you later. Thanks again. Bye, everybody. Bye.
29-year-old diesel mechanic Billy sustained a deep cut to his elbow when a 500-kilo axle from a semi-trailer fell on him.
Yeah, you've done some damage there.
A bolt ripped into the crevice of his elbow, causing a deep wound.
You just got to rip it open.
Dr Jonathan feared Billy had a severed artery.
Brachial artery has been transected, i.e. cut in half.
Following extensive surgery to repair the artery, Billy spent 4 days in hospital and is now recovering at home.
Considering everything, I'm doing pretty well. We had to get a forklift to actually lift the axle off my arm. I'd be a little bit nervous about changing an axle again.
Billy's partner Hillary thinks his former work in the military helped him keep a cool head.
I brought you a drink.
Even when faced with excruciating pain.
He's one of the most wonderful people I've ever met, and I really, really admire him because the self-control, even in crisis, he doesn't freak out. It's a big relief for him to be able to be back on the tools at work because that is where his heart and soul is. So I'm so happy to see him back doing what he loves.
Tweedledum and Tweedledee. The care that I got at the Royal Melbourne Hospital was unreal. I was lucky with the team that I had around me to make sure that I'm still alive and I still have my arm. But I can't thank them enough for what they've done.
Emergency doctors Andrew Trezise and Jane Hamilton.
Do you know, I always wanted to be a children's TV programme presenter when I grew up.
Did you?
Yeah.
And now you're stuck doing medicine.
Are discussing dream jobs they wanted to do when they were kids.
Yeah, it was either the presenter or a doctor.
I mean, I used to want to be a truck driver, so, you know.
Did you?
Yeah, when I was about 6, I was like, I just want to drive a truck.
That was the age I wanted to do TV.
We clearly had divergent paths, but we've ended up, you know. Oh, dear.
Dr Andrew's sticking with the day job as an air ambulance arrives from country Victoria.
Copy that, thank you.
The patient is 21-year-old Blair, who crashed his dirt bike after failing to land a jump.
Just keep your head nice and still, mate.
Blair was celebrating one of his brother's birthdays when the accident happened.
Yeah, I got 4 brothers. They all good? Yep, they were all there.
Blair's family saw him crash and are now rushing in to the Royal Melbourne.
They've landed. So I think, yeah, priority is probably going to be some analgesia, which we've got some fentanyl out. They're bringing in a young chap. He's been up in the air and landed probably at, we assume, quite a high speed.
Yeah. Keep your head nice and still, mate.
Come in the room. Sounds like he's either hit his head or injured his leg, or probably both. G'day, buddy. What's your name?
Blair.
Blair. I'm Andrew, one of the doctors here. How you going?
I've been better.
Been better, yeah.
Yeah, no.
When I see Blair for the first time, he's talking to us and he's awake, which is one of the most important things we look for when a patient arrives. That tells me that their brain's working reasonably well.
Ready, set, go. Oh, and back. Ready, set, go. Oh, it's not where it broke your leg.
With Blair obviously in severe pain, the team immediately start assessing him for any internal injuries that could be life-threatening.
So this is Blair. He's a 21-year-old fella. Today he was on a dirt bike.
Yep.
Riding about 40 to 50k. He's gone across a jump. The front wheel has dropped, and he's gone over the handlebars, landing significantly on his helmet. And then the bike has flipped and landed on his chest and on his leg.
Okay.
Initially, he's a little bit confused with retrograde amnesia.
Yep.
Obvious right femur.
Oh, yes, a lot of pressure in there. My femur.
Apparently, he rolled a truck about a week ago.
Okay.
But no major injuries other than a head strike.
Yep. Okay.
So I don't know if that was even investigated heavily.
This is the second major accident Blair has had in the last 2 weeks.
I did roll a truck on Tuesday last week.
Blair's had this pretty recent head injury already. Receiving a second head injury within a week or so is never good. It's always going to make us be a bit more concerned about the severity of injuries that he could have received. And certainly this second one sounds very significant. Could we get portable x-rays for a trauma around here, if that's okay?
Pass is negative.
Fantastic.
Lungs are okay. He's got a lot of pain in his right femur.
Yes. There's no suggestion of any fluid in the abdomen. Blair's probably not got any significant bleeding into his belly. Here we go.
So this was the actual accident.
Before the paramedics leave, they're able to show Dr Andrew footage of the accident sent by Blair's family.
So it's going quite quick. So you can see the bike's flipped over on top of him. Yeah.
We don't often get to see footage of the injury that our patients have. You know, I was sort of imagining he's gone over this jump and kind of landed from the top of a ramp or whatever, but you know, he was right in the air and he's fallen really, really hard. So you've sort of come off this jump, gone kind of forward and probably landed forward onto the helmet. Is that right, do you think?
I don't know.
People tend to get memory loss with head injuries due to the fact that the brain takes a big impact and kind of almost essentially shuts itself down for a little bit. Obviously, it's a pretty decent fall you've had. We'd be worried about head injuries and chest injuries. We suspect, obviously, your right leg is probably broken. Okay, so we're going to get an x-ray of that. And what we'll have to do is we'll scan basically everything from your head down to your pelvis, okay, through a CT scanner. Blair's come off his bike and the only injury is a broken leg. I would be very surprised. We always look for more. The mainstay of that really is a CT scan where we look at the brain, the chest, the abdomen. They're the most common sites for injury and also the most life-threatening injuries.
Next is examine your back.
Before sending Blair for a CT scan, Dr Andrew wants to make sure he doesn't have any obvious spinal injuries.
Also, I need to check around your anus for sensations, to check for spinal cord injury.
Around it or in it?
Around
check the sensation and then you can squeeze your buttocks. Okay.
Yeah, he's in pretty good spirits, isn't he? Like, he's obviously trying to see the funny side of it. I bet underneath he's probably pretty worried about what's happened.
Oh, that leg me there. Watch out for that female, please.
Yeah. We're going to support it here on your count.
Ready? 1, 2, 3.
Emergency nurse Gunnar Pedersen is a world away from where he grew up in Iceland, but is now happily settled with his family in Melbourne.
Oh, this was a beautiful morning. Woke up early, dropped the kids off to school. I listened to some death metal on the way and get myself geared up for the shift and hope for the best, prepare for the worst.
As the ED's resus team leader,
I got more phone calls. This is endless.
it's Nurse Gunner's job to coordinate resources
Resus 5, bring them out.
in life and death situations.
Now we're getting 2 very sick people at the same time. This is like orchestrating a very chaotic symphony.
But as a father of twins, he's an expert in juggling.
This thing does not stop. Yeet. The things get very busy very fast, Dad. And my job is to ensure that it happens safely.
The ED receives word of a trauma patient about to arrive.
See you in 10, 15 minutes. We're on over now.
So we got a patient falling off a horse. I've seen quite a few nasty injuries from horses. Long face. So I'm not sure of the ETA, probably about 10 minutes. So let's get started, get a team together.
With an injured horse rider on the way, emergency Dr Jonathan Papson is on standby.
When people are on a horse, not only do you fall from a height, but you fall at a speed. So it can be quite a nasty fall off a horse.
25-year-old Laura is in excruciating pain after falling from her horse and landing heavily while show jumping.
Are you a partner or? Okay, we'll maybe get you to stand outside just while we get a hold of the situation.
Ready, set, go. There we go. Well done. Laura, so lots going to happen in a very short period of time, okay?
So she's a 25-year-old female with no medical history. 12:30 today, she's fallen off a horse. Her partner over here has a video of the incident.
Obviously, complaining of pretty significant pain.
Hit her left side scapula and thoracic region on a treated pine post in the ground.
Right.
Fell to the ground after that.
Oh, losing my arm.
Complaining of pretty significant pain in that left thoracic.
Is it posterior rib fracture? She's got a scapular fracture. She's got a pneumo from that. Anterior as well. So that's the business, isn't it?
To get a better idea of what happened, Dr Jonathan talks with Laura's boyfriend, also Jonathan.
Hey, did you have a video?
I do.
Yeah. Can I have a look?
Yeah, so she's jumped, and she's kind of just come off and then straight to the side there. That's the end of it.
All right. Okay.
Laura's had Timmy, a new horse, for about 3 weeks, and this was her first clinic. Just super excited to go out there and see what he can do, because this horse can really jump and he's got some really powerful movements. And then she got in there and done one, and she got through, and then she did the second one, and Timmy just pulled up a bit short, and she's come off, and Timmy's gone to the left, and she's gone towards the post right near the fence, and she's come around and wrapped around like a banana, and she's come off second best.
Laura, hi, my name's Jonathan, one of the specialists. How are you feeling?
Pain.
Been better. Is it pain sort of in your chest on the side?
Just like between my breastbone and all the way.
So in the front?
And all the way through my back.
Yeah, all right. So
It really hurts to move my left arm.
Does it? All right. We're going to get something more for the pain, and then we'll have a thorough look at you. So when we hear someone's fallen off a horse, what I'd be worried about is broken ribs. And when you break your ribs, you can hurt your lung, and breathing is difficult, and that'll make your oxygen level low. So what we might do is cut this off so we can have a proper look. Oh, there we go. Was that the pole or something you landed on? The ambulance said you might have fallen on a pole or something, or struck a beam or something, smashed into the fence. She's got a mark on her chest, so I'm worried that she may have broken the front of her ribs, but there's got to be more to it. With your shoulder, can you move it, the shoulder?
Ready? 1, 2, 3.
21-year-old Blair is being examined for spinal injuries after he crashed his dirt bike and landed heavily.
No. Sore to touch? Yes, no.
No.
Dr Andrew wants to make sure he's stable enough to move to CT so they can scan for any brain injuries.
There's a bruise and a raise. That's sore?
Yeah, wait. Like, wait.
Touching you there?
No, my femur hurts.
No, I'm just going to put a sticker on there, actually.
I get a sticker. I'm a service sausage. My femur. Oh, okay.
Okay, ready? 1, 2, 3.
Oh, I feel it moving. That's a hectic, yeah.
Hold your head down.
It's possible that like if there's a break in your neck as well that you won't be really feeling it, all your pain is focused there, okay? So until we can do the scan, make sure your neck's safe. You want to just try to lay still.
Emergency nurse Lachlan Peterson knows the importance of connecting with patients, especially younger ones.
Got your new Tinder profile up here?
Oh, I do actually. Better give me phone over here. Oh, the birdies will be out.
More than happy to take a few fun shots to yourself.
Oh, stop it.
When you've got the bravado up, these young people downplay things that could be key symptoms.
What's your best side?
Obviously behind, because I've got a mullet.
When you can build that rapport with them, they're much more likely to talk to you about what's going on.
Have some mad painkillers.
Is it tense?
It's very tense. It's probably deformed. Yeah.
We've got good pulses.
Feels very tense.
It's going down the leg and it feels quite firm. The thing we think about is compartment syndrome, and that can suggest that there's potential that the blood supply is starting to get cut off down the leg, which is not good. Did you see as well, sorry, just for a shoot through femur if we can?
Yeah.
Thank you. Thanks, sir.
Dr Andrew also wants to rule out any other major injuries.
Try and take a deep breath in there for me. Hold your breath and relax.
Did you see the chest?
Just looks fine.
Chest looks fine.
Oh,
Yeah, it's okay.
The pelvis X-ray looks clear.
Yeah, it definitely feels tense though, that leg.
Feels very tense, yeah.
Well, we'll see what this femur film looks like, and I'll give also a ring. Yeah, it's pretty badly broken.
Face it.
Yeah.
It looks ugly and needs some operation.
If you fracture the bone, you get some bleeding, and that bleeding can start to become contained by muscles within your leg. If the blood supply is cut off for long enough, the limb won't survive, and actually can cause injuries bad enough that mean that legs basically need to be amputated. That's a very complex fracture.
Lots of little bone fragments that can cause trouble.
Yep.
Good job. Out.
Sorry, Doc. Just giving you some pain relief, okay?
25-year-old show jumper Laura is in acute pain after falling from her horse and smashing chest first into a wooden post.
Are you sore in the middle? You are. So your sternum is sore. And are you sore here?
Yeah.
Does it hurt there? Yeah. Yeah. And what about right around?
That's going to be really sore.
Here, is that sore?
Yeah.
Yeah.
Dr Jonathan's first priority is to get her pain under control.
Probably maybe just get 10 of morphine, and might as well get some Maxilon as well. We'll give us some oral stuff too. What do you reckon? People often have spinal injuries when they fall off a horse, a fractured neck, a fractured back, and truncal injuries, ribs and in your abdomen. The ambulance were pretty comfortable that her pelvis was okay. It's hard to tell. You know, if she's got a broken scapula, she could have a broken thoracic spine. We just need to be gentle and not too rough as we move her around. So just remember, the whole left side of the body, all very sore. So we'll just go very gently as you roll her.
Okay, so stay nice and still there for us, Laura. 1, 2, 3. Laura, pain here in your back? Yes or no? Here? 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 Here in the middle? Here in the middle? You all right? Where is it sore? Everywhere? Okay. We're going to get you some more pain relief, okay?
Excellent work. Okay,
Going back on 1, 2, 3. Going to give you some more pain relief now, okay?
We've given her painkillers, but the pain's still there. So she must have something broken there that we're just not seeing.
Sorry, my darling.
This kind of injury can be devastating and can stop someone from being able to do what they love, which is riding a horse.
Laura's mum, Paula, always feared this day would come.
Laura has had an obsession with horses ever since she was little. We were hoping she would grow out of it. Unfortunately, she didn't, and it just kept getting stronger and stronger and stronger. Being a dangerous sport, it's a type of call you know you are going to get one day. You hope you don't, but I think in the back of your mind, you know it is going to happen one day. Still not good when it does happen.
Sorry, put your arm right side, darling.
X-ray.
So, pelvis is closed, no obvious lumbar spine fractures, hips look all right. It's very reassuring.
Laura's x-rays are clear, but Dr Jonathan's not convinced.
What I'm worried about is that she's got rib fractures that I can't see on the plain x-ray. So I wouldn't be surprised that when we go and do the CT that we'll see quite a lot of them.
Oh, I like your tattoo there. Cross his heart, eh?
So when you get an impact to your upper body, that compressive force can injure the structures underneath, which is really the lungs.
You okay there, Laura? Yep.
It really hurts when she breathes, and that's a problem because she needs to take big breaths to inflate her lungs so her oxygen level remains the way it should be. If it hurts, you don't want to breathe. Right? If you don't want to breathe, your lungs don't work, you know, you're in trouble.
Dr Jonathan wants to get to the bottom of Laura's pain as quickly as possible.
Is she far off or?
Imminent.
Imminent. That's what we like to hear. All right. Needs the scan, so sometimes coming around and talking to the CT people at least makes me feel happy that she's going to get a scan sooner. Going to CT?
Yep.
Yeah. She's a priority. The sooner the better. Let's do it.
"21-year-old scrap metal worker Blair has a badly broken femur after crashing the dirt bike he was riding.
No, when you feel it round, it's actually...
Is it tense around the back as well? Yeah.
Dr Andrew is worried the firmness in Blair's leg could indicate a life-altering condition.
The worst thing really with this kind of injury is potential for compartment syndrome, and if that's really bad, people can lose their leg from that kind of injury.
Dr Andrew breaks the terrible news to Blair.
All right, buddy. So X-ray we've just looked at. Definitely broken that leg. Okay.
First broken bone.
Andy, I'm so sorry to interrupt.
That's
You're
okay.
going to have to move step down for a moment.
Yep.
Because we've got a really sick patient we need to move up.
No problem.
A critically ill patient has been rushed into emergency and needs the trauma bay. Blair is moved to a treatment room.
Sorry for the quick move. Yeah, so I was just saying it's definitely broken. It's actually broken in a couple of places. Okay.
Job.
Doing a great job.
Go hard and go home.
But it's definitely going to need an operation to fix it, okay? Because it's broken in a couple of places. One of the fragments is a bit loose and just hanging around in the leg.
I see.
All right. He's going to need an operation to fix this fracture, definitely. It's going to be very painful for him. The other thing that can happen is with a big fracture like this, you can actually get so much swelling in the leg here that it starts to compress those blood vessels. That's what's called compartment syndrome. Now, if that happens, we're going to have to urgently try and reduce that swelling, and sometimes that means urgent surgery. But we're going to be keeping a really close eye on it. Fractures like this, they need to be fixed sooner rather than later because there's a lot of blood vessels that go through the leg, and there's always a potential that the fractured parts of the bone can shift and move and can actually cause damage to the blood vessels running down the leg.
Dad always told me go hard or go home. Guess we're not going home.
Blair is cheeky. He has a big heart. His head's screwed on properly. He's funny. You always get 100% Blair. Blair is a daredevil, has no fear. And I always say to Blair when he's going to go riding, be careful.
My foot's a bit numb.
Yeah. Tell me if it changes, particularly if it feels like it's getting cold. If the pain shoots up, let one of us know, OK? Because see, we're going to get the rest of the scans done soon. For now, I've got to keep you flat on your back. I can't let you have anything to drink. I think it's definitely now hit home for Blair. He's a lot more worried about what's happened and started to realise things are a bit more serious. He's starting to think, am I going to be able to walk again? Theatre potentially tonight. Okay.
Sorry?
It might be going to operation tonight. Check. You okay, Blair? You okay, buddy? What's up, man?
Oh, I've got a lot of pressure in my leg.
Is it really sore?
Oh, yeah.
Is that sore?
That was.
Here?
No, back.
Back here somewhere. Okay. Breaking your thigh bone's going to cause you a lot of discomfort. The trouble is we also need to monitor how his leg is feeling to him, because if it starts to get more and more and more painful to this point where it's sort of out of control pain, that he's starting to develop compartment syndrome. I think you've probably...
A lot of pain.
You've definitely bruised some of the nerves in your leg, okay?
A lot of pain. Excruciating. It's like I'm having a truck run on me leg.
I'm going to give you some pain relief, okay? And we'll keep a close eye on you, and I'm waiting for the surgeons to come down and see you. Okay. This is a really tough balance. I want to be able to give him as much pain relief as I can, but actually we kind of need to be conscious that if we give him too much pain relief, we might actually start to mask some of this escalation in pain.
It hurts now. Now my foot's going numb. I can feel it right down to my big toe.
With Blair in agony, he's taken immediately for a CT scan.
Just starting now. You're doing really well. We'll be finished in less than 2 minutes.
So Blair's come back from CT now. He's got a fractured leg. So when we're looking through the scans, what we can see is that there is blood flowing through those vessels, and actually that it's flowing all the way down to his feet and supplying the whole leg. We're happy this compartment syndrome doesn't seem to be developing. So there's no obvious big brain injury and there's no obvious neck injuries. And then we just scan down towards the pelvis here. And there you go. So there is a fracture on the left-hand side of the pelvis, which is a little bit unusual because the fractured leg is on the right-hand side. Sort of speaks to how big this injury is that Blair's had. So it's what we call the acetabulum, which is the ball and socket joint of the hip. That can be fractured in high-impact accidents. The reason it's concerning is because that can mean that the hip joint then is unstable. He's probably going to need an operation on both of those fractures and then a long period of physio rehab after that. All right, Blair, how are we going? In terms of the leg, the orthopedic doctors are going to come down shortly and they're going to have a chat to you about what we do from here. As I say, I'm pretty guaranteed it's going to need an operation. All right, but we'll get you fixed up. We'll get you back on the dirt bike eventually. It's going to be a bit of a long road, I think. But we'll get you sorted, okay?
Yeah, well.
You'll get there. All right, bud.
Keep on cracking on.
Yeah,
Okay?
chin up, eh? You'll be okay.
Oh, well.
Good on you. All right, mate. See you later.
I'm sore. Cheers.
Emergency doctor Michael Dunn and his partner moved from Ireland to Melbourne 7 years ago, after seeing rave reviews of the city online.
I love living and working in Melbourne. The culture and sport and food, and had 2 little kids and started a little family here. Yeah, it's been the right move for us.
Dr. Michael's been on the front line here for 6 years.
What I love about the job is that no day is the same. It's such a strong team that we have here that you feel part of something big when you come to work. I mean, I feel you come in and you're making a difference.
Dr. Michael's next case is being rushed into ED.
Royal Melbourne receiving.
We're just giving you a heads up. We're coming in with a male who's fallen around 3 metres to the ground. Don't believe there's been a head strike.
The patient is 57-year-old Craig, who's fallen off a roof.
You all right?
Paramedics have given him the green whistle for pain relief.
We have a gentleman in his 50s who's fallen from over 3 metres. And we've seen people who've had life-threatening injuries from falls of smaller heights than that.
Trauma 1? Okay. Yeah.
Emergency nurse Ebony Butterworth needs to quickly find out what Craig's injuries could be.
Brief story. What's the brief story?
Fall from around 3 metres height onto ground. Obvious fracture.
Humeral fracture, okay.
Father of 3 Craig has been a roofer for 37 years. He's had falls before, but this is the first time he's been seriously hurt.
Hello there. What's your pain score out of 10 right now?
4.
Okay, cool.
I don't quite believe what he's saying. You can see the break in his arm, and I feel like he could be one of those sorts of people that doesn't want to be a bother or make out as if it's something to worry about, but I'm worried about it.
Have you broken a bone before?
Never.
Never.
When he fell, the right side of Craig's body took the full force of the impact, leaving his arm broken near the shoulder.
Hi, Craig. Hi. I'm Michael, I'm a doctor. It's nice to meet you. What happened today?
So I was working on the roof. I went to stand on the ladder and stood where I shouldn't have and hit the ground.
Did the ladder slide or did you come off the ladder?
No, I sort of tried to grab the ladder and tried to stop my fall and ended up all twisted.
And you think you fell 3 meters?
Correct.
And family-wise, who's at home?
My wife's on her way. She's at work in Geelong, so she's having a cup of coffee to calm her nerve.
Very sensible.
Craig's son Alex is on his way to be with him, while his other son Tim waits at home.
And anyone else at home?
We've got a 31-year-old son with an intellectual disability that lives with us as well.
Okay.
He's got a carer there with him. He's priority.
Good, okay.
That he has a son who he cares for brings to light where his mind may be. If he can't use that arm, he can't work. I suspect Craig is pretty worried and pretty scared.
Because you've fallen such a high distance, we're going to have to make sure you haven't injured anywhere else. Because of that sudden impact, some of the organs get shaken around to make sure they're okay.
Yeah.
We'll take you for a scan.
No worries.
It's crucial that Dr. Michael finds out if Craig has any potentially life-threatening injuries.
Were you walking around after it happened?
I stood up, but then I started to feel dizzy, so I can imagine. I better lie down. I think you might fall down.
Yeah.
Alarm bells go off. Craig may have hit his head when he fell, he doesn't remember, and he could have some degree of brain injury that could be a life threat.
Well, she's fallen off a horse, so I'm anxious to see what a scan looks like.
Yeah, of course.
Yeah.
25-year-old show jumper Laura is about to be scanned for injuries after being thrown from her horse Timmy during a training day.
Initial x-rays look fine, but we're nowhere out of the woods because you only see a third of rib fractures normally anyway on the plain x-ray. All right, mate, you reckon we can go in? Yep.
Dr. Jonathan fears the passionate rider may have spinal injuries.
Oh, sorry. I won't grab the shoulder. How about I just grab that bit? Is that all right?
All right, just deep breaths, okay? All right, on 3, 1, 2, 3. On 3, 1, 2, 3.
Well done. So just that left shoulder scapular area is really sore.
1, 2, 3. There you go.
Well
You're on
done.
the CT bed now, okay?
Is it broken? It's really sad when someone's doing something they love and then you see them have an accident and it's kind of all turned on its head. It might be broken. Could be, yeah. A nasty horse fall injury could be the end of someone's career riding a horse. So let's just hope that her spine's okay on that CT. They'll reformat the images. I think we've got lots of rib fractures, no surprise. But we'll wait for the reformats and then we'll have another look.
Laura is taken back to the trauma bay, where she'll wait to find out if her riding days are over.
Laura and horses, that's her everything. Every spare minute, if she's with a horse, whether she's cleaning them or feeding them or riding them or brushing them or just looking after them, her whole life revolves around horses. If she couldn't ride, she would have a pretty miserable life. She wouldn't know who she was.
Finally, Dr. Jonathan can clearly see Laura's injuries.
It's amazing compared to the plain x-ray. I'm seeing a lot of broken ribs and they're actually displaced and out of place all the way down the left side of her chest. So no wonder she's in so much pain. Let's see if we can have a look at the sternum, so the breastbone. Yeah, there's a little break in that too. So she's got a fracture in the sternum, which is why she's so sore all the way around. She's got the big red mark here. That makes a whole lot of sense. The ribs will take 6 weeks to heal, but her pain's probably going to be worse for a couple of days. All this looks pretty bad, but look, Laura's a fit young person. How long do I think it'll be until she's back on the horse? Let's hope it's not too soon, because we've got to get those ribs healed. But she'll be back on that horse.
"54-year-old roofer Craig is having a CT scan.
We're not going to do a full roll, obviously, because this arm is very sore.
Dr. Michael is looking for internal injuries after Craig fell 3 metres off a roof, badly breaking his arm.
1, 2, 3. There we go. Good job.
At a fall at that height, Craig could have had some bleeding in the brain, spinal injuries, injuries to the lung, heart, the liver. Those sort of things can be pretty catastrophic.
Brain scan looks good, so I was waiting for the rest of the scan.
And ready, steady, stroke. Great.
Craig's son, Alex, is here to see his dad.
Hey, Dad. G'day, how you going? You going all right? Yeah, well, yesterday we talked about sort of never broken a bone, so break too soon. Exactly.
Craig's scan shows he doesn't have neck or spinal injuries.
Hello.
Yeah, mate, how you going?
I'll take this off.
Thank you. I knew that was all right.
How's the head?
Yeah, fine.
Yeah. Chin to chest? Good. Good. Okay, good.
Dr. Michael needs to find out if Craig's broken arm will need surgery.
Hello.
Hello, how are you?
So we need to go for an x-ray.
Okay. $500 bet that my arm's broken.
I would bet the same thing, actually. Yeah.
While waiting for x-rays, Nurse Ebony has seen something alarming.
Definitely looks more swollen than before.
Just like numb pain.
Okay.
His arm suddenly looks even more swollen, so that is a major worry. He's at risk of compartment syndrome, which is extremely serious.
Don't be too tough, all right? You need to let me know when you got pain, like then.
Hurts?
Yes, okay? See?
Yeah.
The x-ray shows the break in Craig's arm is severe.
This is his humerus right here. He's got a mid-shaft fracture, so that should be one straight line, and it's definitely not a line.
Ruth Tyler and father of 3 Craig is back from x-ray.
The Minister of Finance, mate, you're in big trouble.
Oh, here we go. It's lecture time.
Waiting for him is his wife Denise and son Alex.
What are you doing?
Seeing if I bounce.
Trying to get attention. One way to get on the TV.
This is very swollen here. Are you sure your pain hasn't increased at all?
Yeah, no, I'm fine.
It's okay?
Yeah.
You're not just saying that because your wife just walked in? And...
No.
I'm going to go have a chat to Michael. He can just have a quick look at the x-rays.
Yep.
Okay, cool.
The swelling with Craig's arm is due to the fact that the fracture is malaligned, but also he has some secondary swelling from the actual brick itself. And I'm not concerned at this point in time that he is going to develop compartment syndrome. So he's been somewhat fortunate to come through this without any significant complications.
Hello. We can sit you up. Scans are okay. Just the broken arm, which we know about. The rest of the scans are fine. We're going to get you into a sling, but all scans look very reassuring.
Craig's arm will now be put into a cast.
It's a simple process, and the whole idea is that gravity helps fracture realign. A lot of the builders are chasing plasterers. I'll give them your number. We can't do straight walls, that's our big problem.
For someone like Craig, where his work and his livelihood depends on, this broken arm can be pretty substantial. We don't know what degree of rehab he's going to need so he can do his job safely. So this is going to have a major impact on his life.
With Craig needing to spend a couple of days in hospital, wife Denise is worried what she'll do without her superstar chef.
He likes to buy fresh food every day, so beautiful cook. So we really hope that his arm heals up pretty quick.
Just so I can do the cooking.
It's so cheeky.
Emergency nurse practitioner Paul Casey's next patient's waiting.
Hi, I'm Paul. I'm one of the nurse practitioners. And your name is?
My name's Susan.
55-year-old biology teacher Susan is worried because the painful sore behind her left knee is growing bigger by the day.
I'm here today because now it's an open wound. It just looked like an infected mozzie bite, quite small when it first presented. So we've had antibiotics and they didn't do anything. I'm feeling nervous because it's a flesh-eating ulcer that's taken off.
Susan's come into ED because a GP has found that she's got a Buruli ulcer. It's a ulcer of the skin that originates from a bacteria.
You've had normal sensation in the rest of your leg.
Yes, and it had no pain.
Yeah.
But now that the surface of the skin is broken, that's where the pain is.
The pain's coming in now.
In Australia, it's linked to possums or mosquitoes, but no one knows exactly how it gets into humans.
Right, I'm going to go and set that trolley up. When I've done that, we'll have a look. All right?
Thank you. We bought a Renovator's Delight down at Rosebud last year, and the problem is that the front of the house was covered in ivy. So I've spent last summer pulling out ivy. Within that ivy, apparently, I must have picked up a bacterial infection. Now it has no ivy, but I have an ulcer.
I'll just get everything ready so that it doesn't become a crime scene. So is it blood that's coming out or pus?
Fluid. Clear fluid mixed with some blood.
Yeah. Turn yourself over.
Nurse Paul gets his first look at the wound and can see why the mum of two is so concerned.
I see quite a large swelling to the back of the left knee. It's quite red and quite inflamed. It's obviously been there for a period of time.
You tend to down here,
No.
up here.
Yeah, around.
Oh, looks like it's spreading, doesn't it?
Yeah.
There's probably a bit of pus in there. I'm just going to give it a bit of a clean. All right, I'm just going to take a picture of it.
Nurse Paul photographs the wound, so he'll be able to enlarge the image to look at it in more detail.
Once the bacteria gets into the skin, it releases toxins which then eat away at the skin tissue and then causes ulcers. And the danger with that is you can end up with like a permanent disability because of it.
I'll speak to the infectious disease doctors and see if we need to give you any intravenous antibiotics.
Okay.
And whether they need to do anything more definitive.
Yes.
Nurse Paul's having a close look at the photos he's just taken and can see how fast the infection is spreading.
So the surrounding skin's becoming more red up here and she's tender around here, which suggests the infection may be tracking up her leg.
It's the first time that I've come across a Buruli ulcer in person. I've heard about them, but I've not actually seen one.
So she's got an open wound here, which looks like it's had some pus come out of it. This is quite hard here, as suggested that there might be a collection there. So she needs an ultrasound to confirm that.
Nurse Paul calls on the experience of Dr Jeremy Clark.
Hey mate, how are you?
From the Infectious Diseases Department. Dr Jeremy does an ultrasound to check for infection deep under the wound.
Yeah, no fluid.
And the news is good.
Just very, very angry fat and soft tissue. No, that's okay. Everyone's got fat under the skin. So Buruli ulcer, it makes the skin very, very angry. And this is in a very awkward spot because if there's pus under there, it needs to be drained out.
Okay.
To set the scene of treating Buruli ulcer, it's a long journey ahead. And the first bit will be unsatisfying because it doesn't get better quickly. Okay. In fact, it usually gets a little bit worse at the start. Okay. At the end of 8 weeks of therapy, the ulcer doesn't look that good. Just all the bugs are dead. And then the healing finishes off after that.
Okay.
Dr Jeremy thinks that there's also a staph infection in the wound, and he's recommended an 8-week course of antibiotics.
You can turn over now if you want.
Ulcers are difficult to treat and they can take a long time before they heal properly. So if Susan's in this situation 7 or 8 months down the line, they may even consider a skin graft, but hopefully the wound will heal up in time.
Bit of relief going on now, and I can start treatment today. My leg isn't going to be eaten away, so I'm very happy. So that's a relief.
"21-year-old Blair was choppered in from country Victoria
Just keep your head nice and still, mate.
after crashing his dirt bike on a high-speed jump.
Oh, I thought we were broken, eh?
Blair suffered a severely broken femur and a broken pelvis.
It's definitely going to need an operation to fix it, okay?
Three months on, after surgery and rehab, Blair still has a way to go, but is pushing through in typical larrikin style.
I got some nice scars, battle wounds. Looks like a shark bite. And then I pull my pants off and show them my scars. They love it. I had my right femur surgery and my left pelvis. I know I got a big nail through my leg, through my femur, 2 screws and a piece of wire holding a butterfly fracture off. And then I've had my pelvis surgery as well. In my x-rays, looks like I had a pocket full of screws.
With love and support from his family and mum Rachel, he's putting his life back together.
I like how you're positive. You're a good boy.
Cheers, Mum.
Super proud of you. Hey, my precious little man.
Thanks, Mum.
That's all right, yeah.
But it's only a matter of time until Blair's back on 2 wheels.
My only regret is not hitting the jump fast enough and not making it. As far as jumping on a motorbike, I will go back to doing that because it's just fun. I enjoy doing it.
After clearing ivy in her garden on the Mornington Peninsula, biology teacher Susan came into ED with a rare flesh-eating borreliosa that was getting bigger. Nurse practitioner Paul called on the experience of Dr Jeremy from the Infectious Diseases Department. After having the wound dressed, Susan went home with a course of antibiotics and a warning it may be many weeks until the ulcer would heal. It took 2 months, 2 operations, a skin graft and a week in hospital to finally rid her leg of the ulcer. And now, Susan is back at work. 54-year-old Craig fell 3 metres off a roof, badly breaking his right arm.
This is his humerus. He's got a mid-shaft fracture.
It was a serious setback for the hard-working father of 3, who's been a roof tiler all his life.
If he can't use that arm, he can't work. I suspect Craig is pretty worried and pretty scared.
After surgery to put a plate in his arm and a night in hospital, Craig went home to recuperate.
I can't wait to get all the weeds out now that my arm's getting better.
Yeah, we'll get there. Just do a little bit at a time.
Despite his wife Denise's concerns about him working on high roofs, he has no intention of quitting the business.
I certainly get my fair share of lectures off Denise about it, saying I shouldn't be doing it. Got to pay the bills. I'm a creature of habit. It took me a long time to get half decent at it, so I like to stick to what I'm good at.
Since the accident, though, Craig is being more careful of what he says.
The day before, I was in the office bragging that I'd never broken a bone and hope I never do. So I learnt my lesson from that one. Won't say that ever again. The hospital staff, the doctors, the emergency team in the trauma section, they were brilliant.
Ready, set, go.
25-year-old Laura came into emergency in excruciating pain after falling from her horse while show jumping.
Was that the pole or something you landed on?
A CT scan revealed the cause of her pain.
I'm seeing a lot of broken ribs.
It's been 5 months since the accident, and Laura's life is finally getting back to normal after a tough recovery.
I broke my back, I broke my sternum, I completely shattered 5 ribs. I now have 5 plates with 27 screws holding 5 ribs together down my left, and shattering all those ribs also collapsed my left lung.
She will never forget the moment she fell.
I remember hitting the post and my body just collapsed underneath me. I couldn't hold myself up. So it was quite scary.
Laura's had some challenges with her recovery.
The first probably week in hospital was really tough. I didn't see myself ever being able to get back on a horse again. It was just that huge sort of mental barrier. My family were actually the ones pushing me to get back on the horse. Like, you won't forgive yourself if you just give up on everything and don't get back on.
And now, Laura and Timmy are back doing what they love.
Our first show jumping competition is booked for the end of September. So I'm really, really working hard to get to that competition. The treatment at the Royal Melbourne was just absolutely phenomenal. Very understanding and lovely and reassuring me about everything. My life's going really, really great now.
We are inbound and be with you in 10 minutes. Requesting clearance to land.
HEMS 2, this is Royal Melbourne Hospital. You are clear to land.
An air ambulance is heading to the Royal Melbourne, coming in from country Victoria.
We've had word a gentleman has crashed his car driving at high speed and the car's rolled over several times into a paddock. So many possibilities for injuries from that kind of mechanism.
Dr Jonathan takes the case and will lead the trauma team.
The helicopter's on the pad. They're about to arrive.
The patient is 72-year-old James, known as Jim.
Yeah, we're good.
He was driving his ute in a 100k zone when it left the road, rolled several times and landed in a paddock.
How you doing there, Jim? Good.
When the accident happened, the retired draftsman was on his way to the local shop to buy food for his dog.
There's a lot of question marks on this bit of paper, which is always concerning. At that speed, with that kind of force, there are many possible injuries someone could have. Now, when an older person is involved in a high-speed car accident, well, this thing just multiplies. This is a highly dangerous and a highly significant event for an older person.
Jim, we're going to move you onto the hospital bed, OK?
No problems.
1, 2, 3.
And we're ready for the story.
He was unconscious, he was trapped in the car, and the local fire brigade had removed him.
On the sides here. Yeah, a little bit.
His blood pressure is 108/70, no allergies, he's a lifetime smoker.
It took emergency services an hour to free Jim from his wrecked ute.
Across the front of his chest, he's really quite tender, particularly left more than right.
OK.
In his frontal pelvis area, very tender as well.
How are you going there, sir? My name's Jonathan. I'm one of the emergency doctors. How are you feeling?
Good.
Did you, look, the ambulance said you were sore in your left chest and you're sore in your pelvis. When you break your pelvis, you can bleed from the veins and the arteries in the pelvis. The mortality, if you like, from broken pelvis goes up every hour that the pelvis hasn't been treated fully. So it's one of the injuries that we're probably the most afraid of in emergency medicine.
I don't even know what happened.
No, that's all right.
I got out of the house.
Yeah? Where were you going? Where would you have been going?
I was going to get food for my dog and everything.
Oh, yeah, going shopping.
Yeah, that's... I don't remember anything.
No. Often when older people are in car accidents, they don't remember everything that happened. Is that concussion or is it because he's got a nasty brain injury? I'm hoping this is just concussion, but you never really know until you get a scan. The lungs are okay?
Yeah.
Yes, so normal lung slide and there's negative fuzz, yeah?
Yes.
Yeah.
The ultrasound shows Jim doesn't have fluid in his lungs or any major internal bleeding.
So you're coming to do x-rays? Yep.
Jim lives alone with his dog Teddy. His daughter and son are on their way in to be with him.
Dad's never had an accident in the car. He's a pretty good driver. He drives that road quite often, going to the shops. He rescued Teddy from the RSPCA. They've been inseparable ever since.
I think the priority is the pelvis. If you can do the pelvis first, please. Yeah.
X-ray.
Maybe he's broken his hip. Just put the buckle right over the bits that are important. On his X-ray, I just wonder whether he has cracked one of the pubic rami, one of the strut bones off to the side. We put pelvic binders on people to hold their pelvis together. The only trouble is when you put it on and you X-ray it, all you see is the buckle. And the buckle usually just happens to sit right over the area that's fractured.
X-ray, trauma 2.
As Dr Jonathan checks the chest X-ray, he sees something ominous.
No, I think that's a primary lung problem. That's a primary lung cancer. He's a lifelong smoker. Whenever we see a tumour in someone, that's always serious. James is a smoker. He's got a mass in his lung. Smokers get lung cancer. I'm not sure whether James knows about this. It might be that we've just discovered something that he hasn't known about. Always positives and negatives. If he never had the car crash, he never would have known and we wouldn't be able to treat the problem. We do find things like this when we look at people, so that's life, isn't it?
Where are you going, Jung?
Growing boy.
What are you doing with all that bread?
Going upstairs.
To make it through a busy day in the ED, Dr Sung Chung likes to adhere to a strict diet.
Peanut butter and jam.
can't even be bothered toasting it. I'll have it for breakfast and lunch. This will be a usual dinner for me as well. I never get sick of apricot jam and peanut butter because there's always an alternative for strawberry jam with the peanut butter.
Row up and go ahead.
I have a patient, 66-year-old female. She was traveling along a stretch of 100K zone when she's impacted with an embankment. Injury pattern, finger avulsion, just pain on her right ankle. BP, last one was 83/37.
Dr. Chung's peanut butter and jam sandwich will have to wait.
Chung speaking.
As he gets news of his next patient.
Sounds like she was involved in a very high-speed accident. She's complaining of chest pains and pain in the hand, pain in the foot.
Blood pressure of 80 and falling. 100K car crash.
Oh, God.
The team prepare the trauma bay for all possible injuries.
Oh, she's here.
Paramedics arrive with 66-year-old Rosalind, a mother of 3, who failed to see a T intersection and crashed into an embankment.
Hello there. I'm Sarah, one of the nurses. Hi.
She was driving to help her son Michael, who'd got a puncture on the bicycle he was riding.
We're going to do everything for you, okay, Rosalind? You're very safe?
Not yet,
Can I
Dad.
just move my finger?
Yep. You ready? On 3. 1, 2, 3. Good job.
Emergency nurse Sarah Thomas wants to make sure Rosalind is as comfortable as possible.
There's going to be people coming at you from all different angles, okay?
Yeah, I just get a cramp in my back, so.
In your back? Whereabouts?
Oh, I think it's just my arthritis.
Now, my love, we're just going to get all of these stuff off you, okay, and get you connected to our monitor. Is that okay?
Yeah.
Yeah.
I've had lymph nodes taken out of that arm, so nothing in that arm.
Yeah, that's right. Nothing on this arm. When Rosalind tells me that she's had lymph nodes removed from her arm, my mind jumps to the fact that she's probably had breast cancer or some kind of metastatic cancer recently. It's incredibly frightening when people have something that happens that brings them to us. It's probably one of the worst days of their life.
Tonight I brought you Rosalind. She was traveling on a stretch of road approximately 100 k's an hour. She's careened into a dirt mound embankment. Airbags have deployed, and she's self-extricated out of the vehicle. She's degloved her right middle finger and painful on the right ankle.
Emergency Registrar Andrew Wallace quickly steps in to ultrasound, looking for any internal bleeding.
What's that? What's sore?
Your chest. Sorry, that was on there. Yeah.
That's just the ultrasound probe pushing down on your chest. Is that what's hurting?
Yeah.
Where were you driving to?
I was going to pick my son up because he was riding his push bike and got a flat tyre.
Yeah. How old is he?
In his 40s.
Okay. Good old mum will come and get me, even when I'm 40.
Mum is really very stoked. She always puts herself last a lot of the time, making sure everybody else is looked after first.
It's been a tough couple of years for Rosalind. She lost her beloved husband Ross to cancer and survived a battle with the disease herself.
Mum was diagnosed with breast cancer just after Dad had been diagnosed. She hid from Dad that she'd found her lump, and then Mum finally finished her treatment, and that's when Dad got worse. Unfortunately, he didn't make it. We looked after him till the end.
EFAS is negative, no pneumothorax.
The ultrasound confirms that Rosalind doesn't have a punctured lung or internal bleeding, but her finger is a concern.
Where are we bleeding from?
Rosalind's finger is in a bad way. My main concern is that the injury is very serious and we may have no option, or the plastic surgeons may have no option but to amputate the tip of the finger.
No, I think that's a primary lung problem.
72-year-old Jim rolled his ute several times after coming off the road at speed.
I'm worried that that's going to turn out to be something nasty, actually.
While looking for injuries, Dr Jonathan has spotted something concerning on his chest x-ray.
That's a primary lung cancer. He's a lifelong smoker. It's no real surprise that an older person who's been a smoker should develop a lung mass. I need to have enough information at hand before I deliver the news to James. So really have to be careful that I give him accurate information at the right time.
You saw more on this left side? Just a little bit. Yeah.
Dr Jonathan carefully continues his examination, suspecting Jim has multiple fractures.
We're just having another look at you, sir. Are you sore in here? Are you sore in your hip?
Could be a little.
I think I can see a fracture in there, in your pelvis. So we're going to get a scan of that. Just one other thing. Are you sore? Do your ribs hurt?
Not a lot.
What about this? Does that hurt?
A little bit there.
Yeah. So you might have broken your breastbone even. It's really important that we get James to CT so we can work out exactly which bones are broken and which organs are damaged. I'm suspicious he has a broken breastbone, a broken sternum, but he may have other injuries, other fractures, lung injuries and lung bruises, and they may be more significant. Why don't we just try and get to CT? Because that'll give us the information we need.
James, we're going to slide you over onto this other bed. You don't do anything, all right?
Ready, sit.
Is there any problem? You can fall out.
Dr Jonathan has grave concerns for Jim. After such a high-impact crash, he could have serious injuries and also a cancerous growth on his lungs. Dr Jonathan anxiously waits to see what the scans reveal.
See if I can get the images.
Nice big breath in there, Rosalind. Hold it there. Breathe away.
66-year-old Rosalind is having an x-ray to look for fractures after she crashed her car into an embankment on a country road.
Is there anything on it?
So there might be a fracture on the left side pelvis.
There's a lot of problems with a fractured pelvis, particularly for somebody of Rosalind's age. It's extremely dangerous.
Just going to get one x-ray of your ankle while you're there, okay? X-ray.
My ankle feels like I've bled away.
Is it broken?
Doesn't look like it. Yeah.
Rosalind's ankle x-ray doesn't show very much. Everything looks okay, but given the amount of pain that she's in, I strongly suspect there may be something broken inside.
We're going to take you to the CT scanner and get some pictures.
Yeah.
Don't forget to smile. I'm kidding, it doesn't take a photo of you smiling. There we go, I got a little laugh.
Are we ready to go?
Yep.
Excuse us.
We need to do a CT scan pretty quickly to check for any kind of injuries that we might be missing and to check the extent of any injuries that we have picked up. Back on 3, 1, 2, 3.
Close my eyes.
Yeah. Just watching her. Blood pressure's dropping a little bit. The danger when Rosalind's blood pressure drops and us being in a CT scanner is that I don't have any of the equipment that I need in case she has a cardiac arrest or she bleeds out.
With Rosalind's blood pressure unstable,
I'm watching her like a hawk. It would be really difficult to treat her if this becomes an emergency situation, but this is what we do, this is what we're trained for. We do very extraordinary things with very limited means sometimes, but obviously our preference would be that we're in an environment that is a bit more controllable.
Well done, thanks. Thanks, guys.
Nurse Sarah wants to get Rosalind back to the trauma bay as quickly as possible.
Hey?
Her son Michael is waiting to talk to his mum.
Have a chat to him.
Yeah, hi Michael. And I'm all right. They're doing all the tests and they're looking after me well, and I don't want you worrying about what happened, okay?
Family means everything to Rosalind.
Yeah, good. Yeah, love you too. Bye. When their father was dying, it was during COVID, and of course if he'd gone to hospital, we wouldn't have been able to see him. So the kids all moved home and they helped look after their dad.
Aww. That time is very precious, yeah.
Dr Chung now has all the information he needs.
Rosalind's CT of her pelvis is good. There's no evidence of a fracture, which is great news. She's got a broken breastplate. With her broken sternum, unfortunately, she will be in pain, possibly for 6 to 12 weeks before it heals up completely. The CT scan of her ankle, unfortunately, show quite a few injuries. There are 3 different breaks in the bones to the ankle. She's going to need surgery on the ankle, probably pins.
And there's more bad news.
The X-ray of her finger confirms my worst fear. The X-ray shows complete destruction of the end of her finger. The tip of the 3rd finger is completely smashed. It's completely smashed. There is no bone left, so it's all in pieces. I'm going to refer her to the plastic surgeons, but my biggest fear is that they're going to have to amputate the tip of her finger.
Rosalind has a long recovery ahead.
Given that she was traveling at that speed, although these injuries are significant, they could be a whole lot worse. So she's extremely lucky.
Michael's going to bring you some clothes in.
Oh, okay.
Okay?
Probably won't sleep for a while because I'll lay awake and thinking, how did I let that happen? I consider myself a safe driver. And obviously I messed up.
See if I can get the images.
Dr Jonathan is waiting to assess the scan results of 72-year-old Jim, who was driving in a 100k zone when his car left the road and rolled several times.
Oh, yes. Got images. Just dropping into the pelvis. There's the buckle with the spring. Is that broken? That's what I'm worried about. I hope it's not. I think it's okay. I think he's got arthritis, but I don't think it's broken. It looks like James's pelvis is actually okay. I've got the buckle out of the way. We can see behind the buckle, and I'm not seeing that fracture I thought I could see. So that's a relief.
I wonder if they found the dog.
Oh, do you know the dog?
When the accident happened, Jim was on his way to buy food for his best friend, Teddy.
Oh, the little bake. He likes to stay in. I go shopping, bring him back food. And he's such a lovely dog. He'll just sit with you all day. Oh, I love him.
Dr Jonathan continues to search for other injuries.
I'm worried about all these terrible injuries. Oh. His back, his vertebrae look like they're in a bit of trouble. Just having a look at his back, it looks like an unstable fracture in his spine. Let's have a look at his lungs.
Dr Jonathan's main concern now is the potentially life-threatening cancer on James's lung.
It looks like a tumour to me. It's really likely this is a cancer. Smoking gives you lung cancer.
We've got a patient named Jared. He's had a query fall down a set of escalators. We don't have any obvious injuries, however. He's got C-spine tenderness and query cerebral agitation.
Emergency Registrar Dr Andrew Wallace is stepping up to be team leader.
Okay, are you guys happy?
Yeah.
Team leader is the conductor of the trauma bay. You've got to keep everyone focused, and the first things we've got to do is set in motion identifying and fixing any major life-threatening injuries.
Paramedics have arrived with 38-year-old chef Jared, who was found at the foot of an escalator in a shopping centre.
How you doing, sir?
Not dying. Not dying.
Hope not.
With potentially serious injuries, emergency Dr Emma West arrives to help.
Oh, what's happened? Apparently found out some escalators.
So on go. Ready, set, go. And back on go.
Unwitnessed fall down a set of escalators, approximately 3 metres.
Okay.
He doesn't have any hematomas, but he's got pain to his C-spine and back.
Okay.
I'm quite confused.
Okay.
Yeah, you're right. Yeah.
Okay, what would you like me to do?
Oh, primary survey.
Yep. Dr Andrew is
team leader. That means he will be in charge of coordinating the team. I'm there to support him. It's his chance to step up.
Hello. How are you? I'm Emma. Go for it. Do what you do.
He's hit his head, he's in pain, he's not really sure what's going on, and he's really reaching out for some support, and he's grabbing my arm, he's grabbing my hand.
Lay back down, mate, because you could hurt your neck.
Oh, I feel good now.
Do you feel dizzy?
Yeah.
I'm here. Do you know what day it is, Jared?
Thursday.
It's not Thursday, it's Friday.
What?
It's Friday.
It's Thursday. Already?
Yeah.
I can see that he's not quite in his right state of mind. He's concerned about neck pain, and we're not exactly sure how far he's fallen, whether he's tumbled down the escalators or he's fallen off the side of them.
How far did you fall?
I don't know.
What happened to your foot?
I spoke at work.
Did you? Can you look at me? Good.
Don't feel good.
Equal air entry?
Yep. Just try not to move your neck, mate.
I feel good.
Don't feel good. Are you going to vomit? No. We're just going to do a quick ultrasound of your belly.
Hit my head.
Did you?
Yeah.
Where did you hit your head?
They said they were bleeding from the back.
I'm just going to stay here and keep his head still.
My total focus now is keeping Jared's neck still. If he's got a broken neck, he's in a lot of trouble.
Been a good view.
Yeah? You can hear me behind you, can't you? Yeah. The main thing is you have to keep your neck still, right? You've had a big fall.
Please scared.
Don't be scared, we'll look after you. Yes.
That looks like a tumour to me.
Dr Jonathan thinks he's seen a tumour on the lung of 72-year-old Jim as he treats him following a major car accident.
We'll just cut to the chase here.
A detailed report from radiology confirms that James also has other potentially life-changing injuries.
Oh. Oh. He's got fractures in his neck and he's fractures in his back. This is really nasty. There's something else wrong further up, I think. The L1 fracture's sort of midway down your back, and it's a burst fracture. So the body of that vertebra, one of the structural supports, has actually given way and burst and blown out. So that won't be able to hold up the rest of his spine. He's probably going to need an operation to hold his spine together. He's got a broken sternum. There's supposed to be a joint here, and there's a joint here, but there's not supposed to be a joint there. It's got an extra joint equals fracture. There's a lot of bad news I'm going to have to give this poor man right now. It's really awful to have to give people this sort of news. It's part of the job no one likes doing. How are you feeling there?
All right.
All right? You've got some fractures in your spine. You've got a broken neck and you've got a broken back. So we're going to put you in a special collar that's a bit firmer to hold your neck still. And you've broken your breastbone too. And the other thing is I can see a shadow in your lung up the top. And I'm worried it might even be a tumour. So that's something else we need to look into while you're here, OK? Yeah. So I know that's a lot to digest, but there's a shadow on the lung, broken neck, broken back. Looking at James's fractures, he's got a long road ahead of him for the bones to heal. You'll probably need an operation, then you'll need some rest time after that, some rehabilitation time. So we're looking at months to get things going again for James. Once we know what the orthopaedic doctors want to do, then we'll be able to give you an update, all right? I'll come back and we'll talk later.
I'm just going to stay here and keep his head still.
38-year-old Jared's disorientated and frightened.
Really scared.
Don't be scared, we'll look after you.
After falling 3 metres from an escalator.
Unwitnessed, but when people have attended, he's potentially had episode of loss of consciousness. Definitely no concerns about seizures.
So he's fallen 3 metres.
Max 3 metres down the escalators. He's been on crutches with the cam boot as well.
Jared, he's really very frightened and not very organised in his thinking at the moment, which might be the head injury.
He's complaining of C-spine and thoracic spine pain.
Yeah.
No definite head injury, but suspected. I suppose he would qualify as a trauma alert.
He is a trauma alert.
Yeah,
He should have a trauma alert.
Trauma alert because he's 3 metres. So I think plan should be, if we'll continue primary surgery, we'll do our fast and we'll aim for a CT.
What I'm going to do is I'm going to roll you on your side in a minute. Not yet. And we'll have a feel of your back, but then we're going to do a scan.
Just do ECG. Just relax, sir.
Are you sore? Where are you sore?
My neck.
Don't move your neck. Who do you live with at home?
Girlfriend.
Okay.
Jared's terrified and his partner is away and can't be with him, so he depends on Dr Emma for support.
Go away.
I'm just helping you remember not to move your neck, okay? So you just have to stay nice and still, okay?
Now ask you to breathe in and hold your breath as well if you can, okay? I'll tell you when.
Stay still, don't move. He's scared, he's surrounded by people he's never met before, and he's really, you know, just feeling alone despite all the people in the room. I've got your hand, don't move your neck. Remember me? Nice and still. Look at the ceiling.
2.5.
Yeah, I know. 2.25 marks of fentanyl. Yeah, great. Pop your hand down.
Ready for X-ray.
Suddenly, there's a problem.
You awake there? Jared?
X-ray.
Jared? While I'm standing with Jared, he is losing consciousness and at the same time he's stopping breathing. It's very, very concerning.
Jared? Jared?
Nurse practitioner Crystal Maloney has brought her dog Otto into the ED offices as part of a de-stress program for emergency staff.
This is my 4-year-old Bernese mountain dog. Otto is a very popular colleague. He gets lots and lots of love when he comes. Such a joy to see. He's so happy that then can't help you feel happy as well.
Hello, beautiful boy. He's the most gorgeous animal that I have ever seen. Size, I just want to ride him to battle.
And I think they can help alleviate a lot of stress that you might be feeling. I think he loves it.
Just loves it.
Leaving Otto with his newfound friends, Nurse Crystal has her next patient waiting for her.
Hi, Tule. I'm Crystal. Hi, Crystal. I'm one of the nurse practitioners.
Tule, a 44-year-old mother of 2, has come in with severe chest pain and breathing difficulties.
Can you tell me in your words?
I've been having short of breath I'd say after midnight.
After midnight, okay.
It started from after midnight and my chest pains were starting to get worse. Because I was getting chest pains and hot and cold flushes. And then the ambulance came and then they put a mask on me with air.
Yeah.
And then they eased it a bit.
Yeah, good.
And but I've still got my pain. I've got still chest
Still got pain in there. Do you mind if I have a listen? Tule was woken up feeling that she couldn't breathe and feeling very short of breath. It can be very, very frightening if you can't breathe. That's it. Good.
I've got a chronic asthma.
And what do you take for your
Ventolin.
asthma? Ventolin. Now, do you smoke? Asthma can be life-threatening if someone's having an acute event and they can't get the help that they need when they need it. It can be very, very serious.
Even though she has a history of asthma, Nurse Crystal needs to investigate further.
Whenever someone comes to me that says they have chest pains, you immediately think of their heart. But then there is a lot of structures within inside the chest that can cause chest pain. But I need for you to have your chest x-ray. So someone will come and collect you for that, take you around for x-ray, bring you back. But we can still treat you with your Ventolin and your spacer in between. Okay? All right, I'll be back soon. We know that she has asthma, and we also know that she is a smoker. If she has any illnesses, like a viral illness, like a cold or something like that, that can exacerbate her asthma and make it harder for her to breathe. We'll do a chest x-ray to see whether it looks like she has a chest infection, to see whether her heart is involved, and we can do an ECG as well.
Take a big breath in and hold. Just breathe normally, all done.
We need to work out where that chest pain might be coming from. And this is not a cardiac event, like a heart attack. And have you been unwell recently?
Yes, I've just lost my father not long ago.
Okay.
And he's had some lung problems as well.
Yeah, that's a stressful event.
Yeah.
In Tule's grief, there is an element of anxiety that can make her feel short of breath, and she can have symptoms of shortness of breath. I'll let you pour what you like in that, and I'll come back with the water for your mouth. Thinking about someone who passed away from a similar medical illness, and maybe they're headed down the same path, and that could be quite distressing.
My dad had lung problems, and he just passed away 2 months ago. He had a bit of a lung issue, so I hope it doesn't come to me. Oh, we weren't expecting it so soon. He was 79 years old. So I was there when he passed away. And then I lost him. Yeah.
Nurse Crystal reviews Tule's x-rays, looking for heart or lung problems.
This is her heart, the border of her heart here, which is as expected, and these are the lungs. It looks pretty good.
It's good news for Tule that now that we can just concentrate on her asthma.
I'm going to send her home, but I'm going to teach her how to use the spacer and how to use Ventolin properly so that when she's at home and if she has episodes of shortness of breath, she's able to manage herself in a better way. I'm going to go and get a spacer. Spacers, yes. But I want to see how you go now with you trying it. That's it, keep the seal and then press, that's it, and just do your 4 breaths. Keep your lips closed around. Good. Well done. You did it. Good job. Good job.
Thank you.
That's okay.
The next step is to stop smoking. Her giving up smoking is hard because of the stress of her father passing, but as long as she keeps smoking, she's putting herself at higher risk of a significant asthmatic event.
Tule's husband is at home with their children, waiting for news.
I'm better. Can you please come and pick me up?
I really love my job. You know, people come to hospital in all sorts of distress or injury or sickness.
Thank you.
That's okay. And we can make a real difference.
Yep. So just out that way and turn right around the corner. Okay, good luck.
Improved them to the point that they can go home, that they're safe to go home. And home's a much better place than hospital.
I've got your hand. Don't move your neck. Nice and still. Look at the ceiling.
Dr Emma is trying to calm 39-year-old Jared, who needs an x-ray.
Pop your hand down.
Right, ready for x-ray.
But he's drifting in and out of consciousness.
You awake there? Jared?
X-ray.
Jared? Jared? Jared?
Concerned, Dr Jonathan arrives to assist.
Jared?
X-ray.
Jared?
Do you want to just wax them up? Oh, no.
You're all right, mate.
All right.
You're okay.
It's all right,
You're
mate.
okay, mate. You're okay.
Jared, it's Emma. Hello. You have to stay nice and still, mate. Jared is requiring all of my support to just stay still. And at the same time, he's having unusual periods where he's stopping breathing and dropping his conscious state. He's behaving like he has a severe head injury.
I'm so sorry. I'm so sorry.
Is he having a seizure? Is he going to return consciousness? Or is this something that really needs to get immediately to CT because he has a brain injury? Now we're just going to take another x-ray, so stay nice and still.
Yeah, I have faith.
X-ray.
Jared? 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 Now get me the oxygen now, because his SAT's at 86. Maybe we should just tube him. Jared is looking more and more like he needs to be intubated so that we can keep him still and safely be able to manage him in the CT scanner where he doesn't have a doctor with him. Are you okay with that, Andrew?
Yeah. He's not breathing. He's not attending to me. He doesn't wake up and he quickly desaturates. Well, yeah, there you go. So he's doing that. I think we'll just tube him.
And here comes the ketamine.
Jared needs sedating quickly so they can put a breathing tube in.
Are you almost ready?
Yeah, good.
How are we looking position-wise?
Yep, felt that.
Did wheezy at all?
It's very quiet. It's very quiet. Is he tight the ventilator? Yeah.
Jared's in trouble. The tube is in position, but he's not breathing.
He's got no rash, anaphylaxis. Let's run a blood pressure. Oh, that's a bit better.
At last, it's shallow, but there is some breath.
That's better.
Yeah.
I've got air entry.
Can you go on the other one?
Yeah.
Dr Jonathan strains to hear if both lungs are working.
I just want to make sure I'm not down the right main.
You can hear on that side.
Good.
Got equal air entry. It just didn't... It's almost like he had a plug of something and it was blocked.
Now that we've intubated Jared, his airway is protected and it doesn't matter if he's unconscious. The sole focus now is identifying a possible head injury. So as a team, we need to move him immediately to CT to see if there's an underlying brain injury.
The heart rate and blood pressure are fine.
A simple ride on an escalator could change Jared's life forever.
Was that something? No,
It's on the same area, isn't it?
Yeah. Hopefully it's normal.
Hopefully it's old.
Nothing's jumping out.
No.
I'm relieved to see the initial scans look like there's no major head injury.
To make sure the scans are clear, Dr Emma and Dr Andrew take a closer look.
I'm just going through his C-spine just now, just to have a look.
Is it anything? Hopefully not. So far scans look good.
The CT scan's reassuring, but it doesn't completely rule out major head injuries. Jared could still have sustained a severe concussion. The major test will be when he's up in ICU and he's weaned off his sedation to make sure that he's still moving, talking, as you normally would expect him to be.
Jared leaves the ED and is taken to intensive care for monitoring.
1, 2, 3.
72-year-old Jim was choppered into emergency when he rolled his ute several times after coming off the road at speed.
Why don't we just try and get to CT? Because that'll give us the information we need.
The CT scan revealed the retired structural draftsman had major injuries to his back and neck and a tumour on his lungs.
After the surgery, they had also found some lung cancer that he wasn't aware of in some of the scans that they had done. We got told that he would probably need a lot of rehab. He'd be in hospital for quite a while. Towards the last week, he got an infection and he just wasn't responding to any antibiotics and just deteriorated, just stopped responding. And yeah, so he passed. Would love Dad to be remembered for his kind heart, his generosity, and yeah, always tried to make you feel special.
Thanks, Ray.
39-year-old chef Jared was rushed into emergency after falling from an escalator in a shopping centre.
Jared!
Emergency doctors feared he had a brain injury when he repeatedly lost consciousness.
Was that something? No,
It's on the same area, isn't it?
After multiple scans were clear, Jared spent a night in intensive care before being allowed to go home. Mother of two and asthma sufferer Tule came into emergency with severe chest pain and breathing difficulties.
I've been having short of breath I'd say after midnight.
Tule lost her father to lung disease.
We weren't expecting it so soon. He was 79 years old.
After x-rays and blood tests were clear,
It looks pretty good.
nurse practitioner Crystal showed Tule how to better manage her asthma and she was able to go home.
Bye.
There's going to be people coming at you from all different angles, okay?
66-year-old Rosalind was driving to help her son Michael when she went through a T intersection, crashing down an embankment.
Oh, what's sore?
Chest. CT scans revealed multiple fractures, and Dr. Chong was concerned her finger would need to be amputated.
The tip of the third finger is completely smashed. There is no bone left.
Look at you and Dad when you were young.
Memories. When I look back at the accident, I count my lucky stars that I'm still breathing, but more that it was only me hurt.
Rosalind spent 13 days in hospital after successful surgery to fix her broken ankle, and miraculously, plastic surgeons were able to save her finger.
I was really pleased with how my finger is. I can't see where he stitched, so I think he did a pretty good job.
That's you, Carly?
It's a baby, yeah, it's a long time ago. My recovery's going good. I can walk around. When I go out, I take my walker, only because I don't want to have any falls or anything. I'm looking forward to be able to drive again. If Michael calls me again to say that he's got a flat tyre on his push bike, that will mean that I am driving again, and I'll be very happy to be able to do that.
Royal Melbourne receiving.
We're bringing you a 45-year-old male who was a motorbike versus car. He was the motorbike rider. He's got a dislocation and a fractured lower left ankle.
As emergency Dr Jonathan Papson begins his shift, he gets news of a trauma patient who's being rushed into emergency by ambulance.
Well, motorbikes are always a big problem, just period. Problem, motorbike problem.
We'll do a little team break.
Let's do it.
The patient is 45-year-old Braden,
Do you have a pelvic binder on?
Yeah.
who borrowed a friend's motorbike to go to the bank when the accident happened. Paramedics have given the retail worker ketamine, a powerful painkiller.
How you going there, mate?
It takes
You had some medicine for the pain?
Yeah.
Yeah, looks like you got a broken ankle. Yeah.
Nice to meet you, Braden. I'm Liz.
We always worry about motorbike crashes because there's just such a potential for many different kinds of injuries.
All right, on count of 3, 1, 2, 3.
You can break your pelvis, you can break your arms, you can break your legs, you can break the whole lot. Nice and gentle, holding the leg. Yep.
So Brandon was the rider of a motorbike, travelling at approximately 80 kilometres an hour when he collided with a small vehicle head-on.
Just a big breath in for me.
Braden was found approximately 15 metres past the vehicle.
Is your tummy sore at all, mate? No.
He's got significant swelling and pain to the lower left ankle, potential fracture, dislocation.
Lung slide's normal, not tender. Abdo's not tender, I'll just do it fast.
Where's the pain?
Killing me.
He's hit the car and then been thrown through the air 15 metres and landed on the ground. We'll do a chest x-ray. He's got a sore ankle and he's got a sore foot, so we definitely need an x-ray there.
Chest x-ray, please.
Yep.
Braden's been riding motorbikes since he was 13, but today's decision to jump on his mate's bike could have life-changing consequences.
We've just got an x-ray coming through. We can see so much on a chest x-ray in trauma, that's why we still do it. But that looks good.
Hello, how are you going?
Airway's good. Is that ketamine?
Yeah, fine.
Ketamine's it's not just a painkiller, it's an anaesthetic. They become dissociated from reality and they can start to babble and talk and hallucinate and say things they wouldn't ordinarily say. That's just normal for this kind of medicine. I'm just going to check your tummy with the ultrasound. Are you okay? What's going on? What's going on? You're going to be all right, okay? Some of the medicine we gave you might make you feel a bit odd, like you're having an out-of-body experience. The fast is looking negative. The ultrasound actually looks okay, and his lungs look okay, and his abdomen looks okay, so that's great.
I know that we're tackling you from all angles, and I'm really sorry. We'll get you some pain in a minute, okay? It's all right.
With Braden in such acute pain, they need to quickly see what they're dealing with.
Cut it.
Emergency Registrar Dr Andrew Wallace is famous in the ED for his footwear, or should that be infamous?
Well, yeah, I always get a lot of grief for my bright white Crocs, but they wipe straight off, and every little stain's maybe just a memory of trauma and patients gone by. I think they're all right.
But wait, that's not all.
I do a lot of paediatric stuff, so I've always got like novelty socks. Just have a nice selection of Australian bird socks that didn't start as a collection but is slowly becoming one somehow. So I should find out what brand it is and just buy them in bulk.
After flying for over an hour from country Victoria, Dr Andrew's next patient is arriving by air ambulance. The patient is 65-year-old David.
Quick trip down to the ED, David.
Who's gone over the handlebars of his bicycle while riding down Mount Hotham.
How's the pain at the moment, mate?
It's a bit sore.
David had travelled 500 kilometres from Canberra to join a cycling trip with his mates.
Is he a trauma alert? Trauma alert.
Dr Andrew is leading the trauma team.
This guy looks sore. Cycling accidents can be terrible, especially if you're going over the handlebars. We see dreadful injuries from essentially downhill, fast speed.
Hold nice and still. We'll do all the hard work, okay? 1, 2, 3.
The team waste no time starting their assessment, looking for injuries that could threaten David's life.
So David is a 65-year-old man. At 1:15 this afternoon, he's riding down Mount Hotham and his bike has hit a depression in the road.
My name's Natalie, I'm one of the trauma doctors.
He's been thrown forwards over the handlebars, landing heavily, mostly on the right-hand side of his upper right chest. He's not been able to walk since the event. He's got a right side pneumothorax and he's also got a lot of tenderness to his right hip.
Is he on a pelvic binder?
He has got a pelvic binder on.
Thank you.
Who lives with you?
My
David's partner of 30 years, Kathy, is at home in Canberra waiting for news.
Premi survey.
The main things that I'm worried about is right chest, right pelvis, / right hip.
Right, so let's get a chest pelvic X-ray. I'll do a fast scan. Just concerned that this right pneumothorax would worsen. Worried about pelvic fracture, but... David's taken a big fall to his right-hand side. When someone's complaining about pelvic pain, we put on a pelvic binder. The idea of this is to stop any blood loss that's been going on. Any signs of a head injury?
There is a nasal abrasion.
Yep.
Other than that, no scalp fracture.
How is the helmet? Is it compromised? Yeah, okay. The helmet's compromised. David's helmet's cracked. It's in a really bad shape. It's a good thing that the helmet's taken the big brunt of the injury and it's done its job in protecting his head. Right, David, my name's Andrew, one of the ED doctors. As promised, we're just going to do this ultrasound scan, all right?
As Dr Andrew begins looking for internal injuries,
I'm just above here. I'm setting up for the X-ray.
Okay.
David's chest is also X-rayed.
All ready for X-ray when everyone else is?
Yep, ready.
X-ray resus 1. David, do you remember the handlebars sticking in when you went over? Anyway? Like into your tummy or anything?
That's cool.
Okay.
So EVA's positive for right pneumothorax. Negative otherwise. The ultrasound confirms what we thought. David's right lung's collapsed. A collapsed lung is incredibly painful. Every time you're trying to breathe in, the body will be sending really painful signals to the brain.
Pelvis X-ray's ready. X-ray resus 1.
Yep.
So we do have a pelvic fracture.
Yep.
Emergency doctor Natalie Guinea breaks the news to David about the extent of his injuries.
You've broken your pelvis on the right side. I've probably explained like that's all. You can lose 1 to 2 litres of blood into your pelvis and patients can die.
We ordered CT scans.
I don't know whether Tegan did or not.
David's got a collapsed lung on the right side and he's got a broken pelvis. These are big injuries. There could be even bigger ones lying in wait, so we've got to take him for a CT to make sure.
Cut it.
Yeah, do that.
45-year-old motorbike rider Braden has been in a serious collision with a car.
And this one stuff. So that's sort of like a scuffing, skidding kind of injury, isn't it? Rather than an open fracture.
Having been thrown 15 metres through the air onto the ground, it's crucial Dr Jonathan assesses the damage Braden's done to his ankle.
Take it out, take it out.
Well done.
Looks broken.
Ankle, please. Ankle X-ray.
We might as well just put a back slab on that now, and then we'll go to CT. In this situation, we'll put what's called a back slab on. It's just a temporary plaster that'll hold his foot in place. So that means that when we shuffle him across onto the CT table, it won't hurt, because a fracture hurts every single time you move it. So where's the fracture?
The X-ray of Braden's ankle is not what Dr Jonathan was expecting.
Maybe it's the foot. His ankle looks okay, but he's got signs in his foot that make me worried that he does have a fracture there. Is it more the front of your foot that hurts?
Oh, in that,
Yeah, so he's got a foot fracture, hasn't he? Is that sore?
Oh, yeah.
Oh, that's sore. What about this?
Yeah.
Yeah, so he's got midfoot fracture. Yeah, okay. Well, let's get a back slab on anyway. And to do that, I think we should give him some ketamine.
All right, I'm just going to hold your head because we're going to put a different collar on, okay?
Worried about spinal injuries, emergency nurse Liz Wheeler puts Braden in a hard collar.
You're doing really well, mate. All right, this can't be easy for you.
This collar is going to protect Braden's spine. We need to keep him immobilised. This is going to prevent any further damage to his spine.
All right, do you think you can swallow for us? No issues? Yeah. Lovely.
20 of ketamine given.
Having given Braden more painkillers, Dr Jonathan and the team can now stabilise his leg.
You ready? Let's do it. Just going to pop the little thing on your ankle there. You're okay. You're okay. You're okay. That's the way. Yep, I've got that. All right. Good. Good, good, good. Yep. Okay, I'll wrap it up. It's not unexpected that someone with these kinds of injuries will need quite a lot of sedation.
I'll go grab some tape.
Yeah. Not making much noise there. Is it all right? Very good. He's okay? Yeah. Not making any noise anymore.
Take some deep breaths. Hey, mate, you still with us? Brandon? It's got a bit of nystagmus eyes going on. Brandon? You with us?
Braden has become unresponsive.
Big breaths, Braden, big breaths. Braden.
That's good.
Take some deep breaths. Hey, mate, you still with us?
Braden's still not responding.
Is he breathing?
Do you know if the paramedics have contacted your family?
My sister-in-law, I spoke to her.
Okay.
65-year-old cyclist David has a punctured lung and broken pelvis after coming off his bicycle while riding down Mount Hotham.
Spoken to my wife. No, the ambulance.
Okay. We'll make sure they're updated with everything as well as we keep you going, all right?
David urgently needs a CT scan to check for any other internal injuries.
Log roll and binder and remove the old one once we've got our one on.
Dr Andrew also wants to replace the temporary binder that's holding David's pelvis together with a sturdier one.
So actually we'll probably put the binder under from your sides, log roll, feel down, slide it across, 2 bands and then remove it.
This is a dangerous procedure. The team have to keep David's pelvis very tightly bound as they remove the old binder and put the new one on.
Do I need to do anything?
No. The most you can do is just put your arms very gently across your chest, but that's it. Allowing one of the major pelvic vessels to bleed due to a lax pelvic binder or a misplaced one could cause massive injuries to the patient. They could lose a huge amount of blood in their pelvis and possibly death if undetected. We'll go on 3. 1, 2, 3.
It is quite a difficult injury to deal with. And on top of that, there's quite a lot of pain associated with it.
1, 2, 3. Well, that probably won't pull through because it's wrapped round.
How are we going to get a second binder? I've
So-
never done it where we do a binder over a binder.
Yeah, sure. So
We try and loosen the old one for a small amount of time because we want to continue to compress the pelvis as much as possible.
what we're going to do is once we undo this one, we'll just try and slide it upwards and put the other one down. Still on that side. Yeah. Okay. So undo it.
Do you want to cut the buckle?
Yep.
There's a problem.
Where's the scissors?
The orange binder buckle is preventing the old binder strap from being pulled out from under David's body.
Try and cut through. It's tight.
Yeah. No shears. Great.
Yep, it's coming. Hey, good job.
Sorry.
Mate. That's pretty tight. Now we should be able to get the rest down.
We're not safe.
There we go.
Here we are. Okay, that should be last amount of moving about for a while. CT, right.
With David's pelvis secured, he can now be safely moved for his CT scan.
1, 2, 3.
It's very blind.
How are you feeling?
Left leg is a bit sore.
He's got a couple of broken ribs and he's got a pelvic fracture. Looking through David's scans, it's confirmed he's got at least 2 breaks in the pelvic ring. We confirmed that he's got multiple rib fractures, the lungs collapsed, and there is also blood in the chest. I think it'll be difficult for David to avoid an operation. David's got an extended road to recovery. I think he's definitely not going to be able to be riding a bike for weeks, probably into the months.
My wife's back in Canberra. She I don't know, has given me many warnings about be careful on the bike.
Hey, mate, you still with us? You with us?
Is he breathing?
45-year-old motorbike rider Braden is unresponsive after being hit by a car.
Take some deep breaths. Just having a bit of the effect of the ketamine.
To combat his excruciating pain from a suspected broken foot, he's been given ketamine, a powerful painkiller and sedative.
Take some deep breaths.
Any breath, please?
Can you take a deep breath for me, Brandon?
All right, ketamine, yep. In these trauma cases, we don't have a lot of opportunity to fully assess how someone's going to react to the drugs we give them. So we have to make the best guess. So maybe just watch the situation here. But I also need to be aware that he may become unconscious from my strong anaesthetic drugs that I'm giving him, and he may stop breathing for a period of time.
Take some deep breaths. Take some deep breaths, Braden. Brandon, can you hear me? It's responding now. He's breathing by himself. I don't need to help him anymore. And he's alert and orientated, so that's pretty good.
Now that's more comfortable. He probably doesn't have any reason to feel any pain.
Do you know where you are? Where are you? Yeah, and what's the day today? Or the day? Pardon? It's a beautiful day.
With Braden now breathing, their focus returns to his injured foot.
Did anyone check the pulse after we put the plaster on? If you have a fracture and we can't feel a pulse, that makes us worried that the artery's been injured. How'd you go? Pulse or not?
I couldn't get down far enough without moving it.
This looks like a pretty straightforward broken ankle, but if we can't find a pulse, that's a whole different thing. He's in a whole world of trouble because no pulse means no circulation. No circulation could mean no foot. I guess we have got it. Yep, beautiful. He's got a pulse. That means we've got a little bit more time to work out what's going on, to further characterise exactly what kind of fracture he has and what's the best management for it.
I'm going to take you around to CT, okay?
If you're going that fast and you're riding a motorbike and you crash, you're probably going to break something. Looks like it's his foot or his ankle. I'm hoping that's all it is. The CT is going to be really useful.
Brandon, have you ever had a CT scan before?
Just breathe, take deep breaths in.
Braden's quick decision to jump on his mate's motorbike to go to the bank may have been a costly one.
So this is Braden's foot. Oh, well, that's weird. I'm looking at a 3D picture and I wondered whether he'd actually dislocated some of the bones, but it's just the way they overlapped. This looked to be a really nasty accident. Turns out doesn't have many injuries at all. He may have just sprained his ankle. Nasty sprain can be really painful. He's in enough pain for it to be broken, and it looks like it's broken, so it should be broken. So it's pretty amazing if he's only got a sore ankle and a bit of an abrasion.
Remarkably, Braden has no significant injuries after colliding with a car and being thrown through the air. He'll spend the next couple of days in hospital under observation before being sent home.
I am happy that it's not all busted and all out of place. Very, very happy for the guy.
Emergency Dr Lisa Walker has been part of the ED team for 7 years. And today, she's keeping some personal news close to her chest.
Can I steal you away and talk to you about something?
Run away. Do I want to?
Yes, you do. Come on.
I don't want to.
But her colleagues, Drs Jonathan Papson and Jasmine Poonian, have found out.
I need you to hand over a patient to me. It's very important. Come in here.
And they're not going to let her get away with it.
Lisa, happy birthday to our cheerful angel.
Happy birthday.
Happy birthday!
Happy birthday. I'll give you a mask and a kiss. How's that?
And open the card.
Oh God, it's 3D.
How does it feel to work your birthday?
I always work my birthday.
Yeah. How much of your birthday did you work before everyone found out it was your birthday?
2 hours.
That's pretty good.
Then
Normally I go the whole day.
And then one of the nurses found out on Facebook.
Yeah, see, I got a message on Facebook. That's how I knew.
Fixed it.
No,
Oh,
must have passed.
beautiful.
That is beautiful.
But Dr Lisa doesn't have time for cake.
Hey, Lisa, did we put him out as a trauma alert or anything? Yeah, cool.
She's just been alerted that an air ambulance is about to arrive with another severely injured motorbike rider on board.
Motorbikes are dangerous, so you're worried about a complete spectrum of blunt trauma.
The emergency department treats over 400 traumas from motorbike accidents every year.
I think this is a motorcycle, isn't it?
Yeah.
The patient is 27-year-old school teacher Callum, who was riding his motorbike in country Victoria. Callum only recently got his full motorbike licence, and it was his first time out on his new bike.
Straight ahead, guys.
Having been given ketamine by the paramedics, Callum is not feeling any pain.
Hello, sir. How are you? What's your name today?
Thank you, Callum.
So count to 3. 1, 2, and 3, please.
You can start doing your EFAS.
So this is Callum. Callum's 27-year-old male riding a motorbike up in the Yarra Ranges up near Warburton. Reported to be doing 70 kilometres an hour, failed to take a bend properly and come off the motorbike and been thrown approximately 10 metres. Wearing a helmet, full leathers. On assessment, querying a fractured left scapula. Got an obvious deformity to his left mid-shaft femur, so fracture there.
Have you got any allergies?
So he's had a pelvic splint applied, traction splint to his left leg and a collar.
Lisa, EFAS is negative.
Yep.
Do you see any chest trauma at all on him? No? No evidence of what might be a pneumothorax?
Important things, what do you teach?
I teach maths and physics.
What year?
Year 10 to 12 at the moment.
Ah.
I'm just going through the process of deciding if I'm getting back on a motorbike or not.
No would be my recommendation.
Callum's parents, Linda and David, are at the hospital, waiting outside while the emergency team stabilise him.
Just the thought of your child coming off a bike and
the pain they might be in, where they are lying on the side of a road, you know, all that. It was very emotional, the biggest shock I've ever had in my entire life, hearing that.
Take a deep breath in for me, Callum. Hold your breath. Breathe normally.
It does look like he's busted his scapula there.
Callum, hi, I'm Liz, I'm one of the nurses.
Nice to meet you, Liz.
Nice to meet you too.
As the team prepare more x-rays, emergency nurse Liz Wheeler continues to assess Callum.
So the pain's a 5.
Yeah, in
the left. I'm just gonna have a little look. So we've got a sort of a brace in situ, so that might be causing a little bit of friction. If not, it could be related to an injury.
We're going to x-ray the femur.
All right, just got to do another shot of your leg, okay?
All right, so we have an answer for why your leg hurts. You've broken your femur, which is the big bone in your thigh. We're going to do a scan of the rest of you just to see if there's any other injuries.
On my inner thigh.
Yeah, that's also possibly the splint itself as well. It's because they can be quite uncomfortable.
Hey, I know you've been a hero, but do you reckon you might need some pain relief?
It's just
How about we
my
just
thigh.
do it because we're going to go to CT.
I think it's a good idea.
Panadol.
Yeah.
It's getting really painful, the inner thigh on my skin.
All right. What's hurting?
That spot on my inner thigh.
Nurse Liz is growing increasingly concerned about the pain in Callum's thigh.
It looks like it's getting a little bit bigger.
Stinging in my inner thigh.
Is it here that I'm touching? Or in here?
Down, like
here?
Yeah, about there.
It's where the swelling is. I'll just get the doctor to have another look. It could be compartment syndrome, which is where there's a lot of blood that's being lost into the tissue, which is causing a lot of compression on nerves and tissue. This can be very serious. Okay, I'm just checking in about resus 5. The left leg, and specifically where he's complaining about the pain, is quite a significant amount of swelling.
Yeah, it's because he's got a femur fracture, so we need to keep an eye on it. If you diagnose a compartment syndrome, that's an indication to take a patient urgently to theatre to release the pressure.
You know, maybe this is a sign that maybe it's time to stop motorcycling and, you know, focus on my life and relationships.
Callum's accident is making him think about the important things in life. His new boyfriend.
I met someone recently who I've kind of fallen in love with, and I feel like, I don't know if I've been given a second chance to kind of be with them. I met him when I was over in Bali. Yeah, we've been talking, and, you know, he's devastated to hear that in this situation, he can't be here, obviously, and it's difficult, but...
So what would you say it is on a scale of 1 to 10?
Maybe like a 7 or an 8.
Callum's left thigh pain is getting worse.
It's quite concerning that he does have quite severe pain. This could mean that he is progressing to having compartment syndrome. We need to get Callum to CT as soon as possible.
We have a 31-year-old male who was working on his ute, and the ute has fallen approximately 50 centimetres off car jack onto his left side. He's got bilateral neck pain, pain in the left shoulder and left arm and left chest.
As Dr Jonathan is partway through his shift, he gets news of a severely injured trauma patient being rushed into emergency.
That could be serious. Has it been allocated to someone? If anyone's crushed under a car, it's usually a couple of tonnes or more of weight. Just got a feeling that this is going to be worse than what we thought.
There are around 160 severe injuries each year caused by carjacks, including fractures, amputations, and even death.
Obviously, he might have a broken pelvis too if he's crushed.
The patient is 31-year-old Sean, an ex-mechanic who was servicing a friend's ute when the accident occurred.
They'll have everyone ready for you.
The father of 2 is conscious but struggling to breathe after the jack gave way, pinning Sean on his left-hand side.
You're all right, mate?
Paramedics have already given him morphine, a powerful painkiller.
Is this the gentleman who's been crushed under the jack? Yep. Yep. It's pretty sweaty. We'll get you in and sort you out, mate. Yeah. You saw, where are you saw? Across there, okay, yeah. When we see a patient who's been involved in trauma and they're sweaty, that might be a sign of shock. He looks like he's in pain, he's worried. He's been in quite a frightening accident and he's pretty sore.
Ready, 1, 2, 3. Well done, mate.
Sean could have any number of life-threatening injuries after being pinned under a 2-ton vehicle.
He's been trapped, he reckons, approximately 1 to 2 minutes, and he's been able to self-extricate.
Is that the pain that you're trying to breathe through? Yeah.
He's complaining of right and left-sided neck pain, left shoulder pain, with decreased movement in the left arm.
Did you hit your head? Yeah.
No, I didn't hit
your head.
But I got a really bad pain in my neck.
In your neck, okay.
It sounds like he's been able to push the car off himself. Pretty amazing. He must be a pretty strong guy. If he's got a injury to his neck, has he got some compression of his windpipe? And is that why the breathing's difficult? And Sam, what do you got? What can you tell me?
It's definitely lung sliding bilaterally. Struggling to get a good abdo view.
So no pneumothorax on ultrasound. Beautiful.
The ultrasound shows Sean doesn't have a punctured lung.
You've probably got some broken ribs, though. Does it hurt when you breathe? And this is not... Is this sore?
Yeah, when you press that,
yeah.
really
Yeah, you've probably broken some ribs, all right. When your ribs are compressed, you can't breathe properly because your lung doesn't expand, and that's a life-threatening condition. Yeah. Might just get X-ray then, and we'll get the pictures.
Who do you live at home with?
My wife and 2 kids.
Sean's wife can't be with him as she's at home looking after their 2 young children.
He's a good husband and caring dad, and he's doing hard work. He's doing 2 jobs. I can't go with the hospital with Sean because I have 2 kids. I have to look them. And so he said no need to come, take care of our kids.
X-ray.
It's all right, doesn't it? No subcutaneous emphysema. That looks pretty good, doesn't it? It's pretty amazing we're not seeing any broken ribs because he's certainly behaving like he should have broken ribs. I mean, he's been crushed by a 2-ton SUV. When he wheeled in, he said, my neck, he should have a collar.
Keeping Sean's neck stable is vital in case he has a neck or spinal injury.
You know, has he got a blunt carotid injury, right? That's the concern. When people get a blow to the carotid artery, which is one of the main blood vessels in your neck, you can get blood clot forming in the lining of the wall of the artery. And one of the problems is a stroke. This can happen a day or 2 down the track. I think we should CT him, shouldn't we? Let's do it. Make sure he hasn't got that, because we'll miss that otherwise. Did something bang him in the neck?
Dr Jonathan is worried he's damaged his carotid artery and needs to send him for a special type of CT scan.
So I think pan scan and then run some contrast up the carotid. Yeah, we need to do a special CT angiogram and run some contrast through the artery so we can get a better picture of what that artery looks like.
Do you want to call your wife?
Sean recently became a father for a 2nd time. He wants to make sure his wife Shalani is updated and not worrying.
Is she sleeping already? Doubt it.
She giving milk to...
Oh, the baby. That's okay, we can try again.
Sean updated everything for me at the hospital. I'm confident with the doctors and nurses because they know what to do. We need him to come home.
I think it's your breath holding a little bit, but...
Not taking any deep breaths.
Well, that's not good.
3 litres on him.
Yeah, good. Yeah.
Sean is once again struggling to breathe normally.
When you breathe, does it hurt? Yeah? Yeah. Hard to breathe, isn't it? Yeah, okay, all right.
I don't know, it's because of the pain.
Yeah, it'll be because of the pain. We'll just double check this ultrasound again.
Dr Jonathan is taking no chances and wants to perform a 2nd ultrasound.
Yeah, he's underventilating a bit, isn't he? I'm handed his blood gas result. It tells me he's not breathing well enough and his CO2 level's up, and that's no surprise. But even if he doesn't have fractures that I can see on the X-ray, his soft tissues are so injured and hurt so much that he can't breathe properly. Sorry, mate. Sats are dodgy. He's not going to have a heart attack. No, the lung's definitely up, so that's good. No hemothorax. So we repeat the ultrasound, still looks good. He hasn't got a punctured lung, or at least not one that I can detect. And if I can't see it on ultrasound, it's going to be pretty small. Just breathe as well as you can. We're going to give you lots of pain relief so you can take big breaths, and we're going to go to a CT and have a look. All right, let's go. I am worried there's going to be something on that CT because he's in quite a bit of pain. He's uncomfortable.
You're now in the CT department and we're going to scan your head to your hips.
27-year-old motorbike rider Callum is having a CT scan after he came off the road and crashed at speed.
How are you feeling? You right?
Just the thigh.
Is the pain really, really bad? If the pain's unbearable?
It just like stings so much.
The scan will reveal if Callum's shoulder blade is broken and what's causing the pain in his left inner thigh.
We just want to make sure there's nothing else going on.
If this is compartment syndrome, he may need an emergency operation.
All right, let's go.
With Callum's tests completed, his parents, Linda and David, are now able to be with him.
Did it go in slow motion when you crashed it?
No.
In the head, is it deep?
It was just hit the embankment and then I was bang on the ground.
So you starting the motorbike career finished? Maybe.
Yes.
Dr Lisa can now see all of Callum's injuries.
It all looks pretty good. There's major arteries and veins that run through the leg, and you want to make sure that they haven't been damaged in the trauma, which they haven't been in Callum's case.
With the arteries in Callum's leg uninjured, it's good news he won't be needing an emergency operation.
He's not got a compartment syndrome. He's got a displaced femur fracture. So good news. The only thing I can see on your scans is what we already knew, that you've broken that bone in your thigh. I can't see anything else. The bone guys are aware that you're here. We're going to get you into theatre to fix it tomorrow.
To prepare for Callum's operation,
3, 1, 2, 3.
he's moved onto a traction bed, which will help strengthen his broken thigh bone.
So we've got the CT6 splinter, so we're just putting the stuff on for the traction.
What we know about femur fractures is if you can get them back to as close to their normal alignment, their pain's reduced, your bleeding's reduced, your swelling's reduced. And so you need to apply traction. We basically put a counterweight off the end of the bed that's attached to their foot, and that just pulls the leg out to its normal length.
All right, we'll just slowly let it down, okay?
Okay. My ankles feel a lot better.
Yeah, it's better.
Yeah.
As Callum leaves the ED, he seems undecided if he'll ever pull on the bike leathers again.
It'll definitely change the way I ride if I ride it all ever again.
We're going to take you for CT, okay?
Father of two, Sean, may have damaged his carotid artery after a 2-ton car fell on him while he was working underneath it.
I'll leave you in the very capable hands of our radiologists.
Sean has been injected with a special dye so the blood vessels in his neck can be picked up by the CT scanner because Dr Jonathan thinks they may have been damaged.
This whole scan's really quick, okay?
We're worried that he's got a blunt carotid injury. We have to have a look with the CT scan to see whether that artery is actually bruised, injured, dissected, so that we can prevent him having a stroke if it's injured. The last thing we want to do is say, oh, it's all good, and miss that little injury and then have him come back with a big problem. This is the neck and the head, and this is the arteries inside. To have a look and see whether this one was bruised or cut or split. And you would see that there's a kink in the vessel, and there's no kink. It looks okay. Good news, we're not seeing a blunt carotid injury, which is great. It just means that his soft tissues, his muscles, his mass have actually taken the brunt of the impact. We went ahead and we did a 3D reconstruction because I told them he's got rib fractures. Turns out, not really. I'm expecting to find something causing the pain, but I'm not seeing it. His ribs look okay and his lungs look okay. So why the hell is he so sore, and why doesn't he breathe properly? What's going on? Did we scan the right patient? always happy to not find an injury.
Relieved, Dr Jonathan now breaks the good news to Sian.
How are we going here? So my quick look at your scan looks all right. Now that things have calmed down a bit, we'll just go a bit more precisely.
With Sian still in pain, Dr Jonathan wants to be 100% sure he's in the clear.
So does this one hurt? Oh, that hurts, yeah. And does this one hurt? Yeah, that's sore too, yep, okay. And this one? A little bit, that's sore, yeah. And this one? It's all sore, isn't it? Yeah. Even if he doesn't have broken ribs or a punctured lung, he could still run into trouble overnight just because it hurts too much to breathe, because they're not expanding their lungs properly and their lungs can clog up and the bottom parts of the lung can collapse. So what I think we do is we keep you in hospital overnight. We give you some painkillers regularly so that you can breathe properly without it hurting. That's why we have the painkillers. So this is just for this situation, yeah. I'll come back, all right?
65-year-old cyclist David arrived at the Royal Melbourne after being thrown from his bicycle while riding down Mount Hotham.
So EVA's positive for right pneumothorax.
Dr Andrew found a punctured lung and a fractured pelvis.
These are big injuries.
David had surgery to fix his broken pelvis.
There was a couple of metal plates put in the hip, and then there was another pin put across the back to stabilise the pelvis.
He spent a month in hospital in Melbourne before he was able to go home to recover. And as for getting back in the saddle...
I'm a little bit nervous going on the road again. I've not gone beyond my street, really. You know, I'll be sticking to bike paths for a while.
I can keep an eye on you.
No, thank you.
Remember, be careful.
I shall.
But have fun.
OK.
See ya.
See ya. Thanks.
It's like the old Dave. And that's a really good thing. He's feeling good, feeling happy, and happy Dave, happy wife. Yay.
45-year-old Braden was in severe pain with a suspected broken foot after crashing a motorbike he'd borrowed from a mate.
We'll get you some pain in a minute, OK?
Remarkably, a CT scan revealed Braden didn't have any serious injuries.
It's pretty amazing if he's only got a sore ankle and a bit of an abrasion.
Knowing how lucky he's been, Braden's not planning on getting back on a motorbike anytime soon.
I'm staying off the bike now. No more bikes for me. That's it. I'm getting too off this stuff.
2 days later, with just a sprained ankle, he was able to go home. School teacher Callum was airlifted to the Royal Melbourne after crashing his motorbike at speed. An X-ray revealed he'd broken his thigh bone, which left him wondering if motorbiking was really for him.
It'll definitely change the way I ride, if I ride it all ever again.
After 3 days in hospital, Callum was transferred to a rehab clinic where there wasn't good news.
They found a blood clot in my leg. That was a bit of a setback mentally. I found that quite challenging.
It was nearly 3 months before he was able to return to the classroom.
When I got back, the students were very excited to see me.
As for getting back on 2 wheels, these days, Callum's preferring 4.
Since the accident, I've gone and got my car driver's licence. I needed a car, something with 4 walls and a roof around me to keep me safe. My parents have been very pleased that I no longer have a motorcycle, and yeah, they're much happier with me driving that. They can sleep at night now.
Everyone ready? 1, 2, 3.
Father of 2 Sian was struggling to breathe after a 2-ton ute fell on him. Dr Jonathan worried he'd damaged his carotid artery.
When he wheeled in, he said, my neck, I think we should CT him, shouldn't we?
Scans revealed Sian had severe bruising, but no serious injury. After 2 days in hospital, he was able to go home.
Now I'm fully recovered, but I have a little painful around my neck. I think it will be all right.
He's still unsure how he wasn't seriously injured.
I don't remember at all how I get out from the car. So I just pushed out. Other than that, no idea. It was a miracle to me, actually. When I came out from the hospital, it was really overwhelming and my wife was crying. You came in a one piece. It felt me really, really special.
For the time being, Sean won't be working under any cars.
But after the accident, I haven't done much cars because it still give me flashbacks of what has happened that day. So then it makes me a little bit frightened when I go underneath and put the jack up. Doctors and nurses in Royal Melbourne, I give my heart to them, actually. They've done a really amazing job. I don't know, I could have get that kind of service from anywhere in the world.